Okay, I'm going live on Facebook.
Yes. Yes. Namaskar. Good evening to everybody who have joined us from across the globe. And this is a presentation of ODIA Society of America's Health and Wellness Group. And I will ask Ms. Rashmi Rekha to explain you guys the rules briefly. Thank you.
Thank you. Namaskar. OSA Health and Wellness Group तरफରୁ ଆପଣ ସମସ୍ତଙ୍କୁ ବହୁତ ବହୁତ ସ୍ୱାଗତ। ଆଜି ଏ ପ୍ରୋଗ୍ରାମ ରେ ଆମେ ଆଗକୁ ବଢିବା ପୂର୍ବରୁ ମୁଁ କିଛି ଗୋଟେ ଗାଇଡଲାଇନ୍ସ ଆପଣଙ୍କ ସହିତ शेयर କରିବା ଚାହେଁ। Not intended to primary care physician. This service will offer consultative advice but not the treatment or medication. ଆପଣ ସମସ୍ତଙ୍କୁ ଅନୁରୋଧ କରେ ଦୟାକରି disclaimer ଥରେ ପଢି ନିଅନ୍ତୁ so that there should not be any confusion going further. आउ थे कहिदेबाकू चाहे कि एई सेशन रे समस्त म्यूट रहिबे जदि आपन कोनोसी क्वेश्चन अछि आमे अनुरोध करू दयाकरी चैट बॉक्स रे आपन के क्वेश्चन लिखंतु सो दैट हम डॉक्टर्स एंड एक्सपर्ट आपन को सहायता करिबा रे सहायता करि परिबे जदि आपन हैंड रेज करचंती दयाकरी आपन को ना डका हेला चाहे वेट करंतु आ आमे समस्त को चेष्टा करिबु सब क्वेश्चन को आंसर करिया पे धन्यवाद। वर्तमान मु आम ओसा Health and Wellness Group Chairman Dr. Devashish Rai, Associate Professor MD Internal Medicine, Georgia Atlanta को अनुरोध करे सर प्लीज आरंभ करंतु प्रोग्राम so that I may आगु बढ़ी परिबे।
Thank you, Rashmi, and welcome everybody again. Pranam again. As you know, this is our fourth Saturday event for all ODI people around the globe. And recently, Odisha Ayash cyclone touched. A lot of families have suffered. A lot of families had the pain because of the cyclone. And our heart and soul goes out for all of you. We pray God for you to have Godspeed. And saying that, also, you know, COVID, India and Odisha is going through a very painful journey of this COVID attack. And this session is intended upon manku right news dawa pai so that we don't get anxious, stressed out. And doctors amaro US medical doctors amaro global team of experts Ikaru medical doctors amaro Indian doctors doctors from Odisha are all in our group, and they are here upon manku serve kare pai. Okay, saying this, I would like to welcome you all on behalf of Odisha Society of America's Health and Wellness Group, Team ODIA Doctors International Association, जोटा our global wing, and our ambassadors, Sabyasachi and Narsita. Saying this, I would like to invite Archita Sahu to take the mic. Thanks. Archita, mute Raja.
ସମସ୍ତଙ୍କୁ ନମସ୍କାର। ଲାଷ୍ଟ କିଛି ସପ୍ତାହ ଧରି ଆମର ଓସା ହେଲ୍ଥ ଆଣ୍ଡ ୱେଲନେସ୍ ଗ୍ରୁପର ଡକ୍ଟର ଆଉ ଓଡ଼ିଶା ଡକ୍ଟର୍ସ ଇଣ୍ଟରନ୍ୟାସନାଲ ଆସୋସିଏସନର ସବୁ ଡକ୍ଟର୍ସ ମାନେ ମିଶିକି ଆମର ଯୋଉ ସାଧାରଣ ଲୋକ ଅଛନ୍ତି ତାଙ୍କ ମନରେ ଯେତେ ବି ଦ୍ୱନ୍ଦ୍ୱ ଅଛି ଯେତେ ବି ଡାଉଟ୍ସ ଅଛି କରୋନା ଭାଇରସକୁ ନେଇକି କରୋନା ଭାଇରସର ମାନେ पोस्ट कोविड प्री कोविड रा सिम्पटम्स को नेकी सब आपण माने दूर करछन से पे आपण समस्त को धन्यवाद। आपणकर जहाँ भी टिप्स रही छी जहाँ भी मतामत रही छी सेटा अनेक को घरे रही की बेनिफिट हे पारुची केमिति ए कोरोना भाइरस रे दूर रहे पे मु किछि भी कहबा पूर्वरु ए कोरोना भाइरस रे आम फैमिली होंतु बाबा चिन्हा जणा रे होंतु बा डॉक्टर्स माने होंतु अनेक जण प्राण हराई छथि। तेणु तांको पाई हमें 30 सेकेंड रो गोटे नीरव प्रार्थना करिबा तापरे आगु बढ़िबा। मुझे कहबाक चाहिए गत थर आमर जो वैक्सीन को लेकिन जो सेशन टी हेतिला सेटा अत्यंत मात्रा लोक बहुत साहाय्य करिछि मनर बहुत द्वंद्व दूर करबा पई कि काना मु एटलीस्ट तो कहि परिबि गत किछि दिन भितर मु अनेक ठारू इन्फॉर्मेशन पाइछि जे जो माने वैक्सीन नवा पई कि डरू थिले बा कोनोसी फेक न्यूज रे भासी जाय कि वैक्सीन ता ठीक नहे बोली भाबुतिले सेमान को भितर अनेक जण रजिस्टर करै छथि वैक्सीन नै छथि तेनु आजिर सेशन जोटा कि रहिछि ब्लैक फंगस ऊपर आ मेंटल हेल्थ ऊपर एटा मैं होपफुल जे आपण समस्त जो एक्सपर्ट्स माने आज आम सहित अछंती आम समस्त मनर सब डाउट्स दूर करने को बहुत ही सहाय हेबे सो ओवर टू यू
ମୁଁ ଅନୁରୋଧ करे डॉक्टर देवाशीष साई को काइंडली इनवाइट द नेक्स्ट गेस्ट सर
अर्चिता जी ओ मोना मैम पटे जंदी हैं राइट
Can we mute everyone?
दया करी ମୁଁ ଆଉ ଥରେ ସମସ୍ତଙ୍କୁ ରିମାଇଣ୍ଡ କରିଦେବା ପାଇଁ ଚାହେଁ ଦୟାକରି ନିଜ ନିଜର ଫୋନ୍ ମ୍ୟୁଟ୍ ରଖନ୍ତୁ ଆମେ ସମସ୍ତଙ୍କୁ ଅଲରେଡି ମ୍ୟୁଟ୍ କରିଛୁ ବଟ୍ ଯଦି ଆପଣ କହିବାକୁ ଚାହୁଁଛନ୍ତି ସେଇ ସମୟରେ ହିଁ ଅନମ୍ୟୁଟ୍ କରନ୍ତୁ ନିଜକୁ
संगीता रानी अपना नेक्स्ट इनवाइट करिवे
Yeah.
देवाशीष भाई
Okay. On behalf of OSA Health and Wellness, I would request Dr. Nitin Doshi to start the meeting with a prayer.
Namaskar. It has been a long journey for OSA Health and Wellness Group, and not to speak of the long suffering for people of Orissa, as well as the entire India and the world. So I thought that I will take this opportunity to pray and obtain blessing for the entire well-being of the people of the world, people of India, as well as people of Orissa. And this is a small from a Jain Shastra for the well-being of the people in the world. So I'll read it now. May the whole universe be blessed. May all beings engage in each other's well-being. May all weakness, sickness, and faults diminish and vanish. May everyone be healthy, prosperous, healthy, blissful, and peaceful. Next, I would like to get a quote from Mahatma Gandhi that goes into the people's action and not to look for the results. We should selflessly work for the well-being of the people as well as for the freedom of the people. So it goes on saying, it is the action, not the fruit of the action, that is important. You have to do the right thing. It may not be in your power, may not be in your time that there will be any fruit, but that doesn't mean you stop doing the right thing. You may never know what results come from your action, but if you do nothing, there will be no result. So friends, let's get together and try to help our community, people in Orissa, and the goals of Orissa Health and Wellness Group. Thank you and namaskar.
Yes, thank you, Nitin Bhai. Thank you, Archita, for such a wonderful presentation. So, showing next slide. So, moving forward, as you know, the Odisha Society of America Health and Wellness Group and our hundreds of volunteers of the Odisha Society of America and its executive and board of governors have joined hand with us and creating a big project for the people of Odisha and how to help them. As you know, we are preparing multiple oxygen shelters along with local contributors. We are giving ambulances to most of the centers so far. We are giving food around 5,000 per day, and we are giving groceries around 150 per day, and any other needs that we can do during this time. So this is a very big project. And next slide. And I would like all of you to open up your heart and give whatever way contribution you guys can. And the accomplishment so far, no, one slide before, yes. Auction shelters in Titlagarh, Ganjam, Baleswar, Sambalpur, Bhubaneswar is in the plan. So Titlagarh and Bhubaneswar are almost final. And like I said, food package, helping immigrants, grocery package, and ambulance services. And this is all for this COVID project to help our people in Orissa. Next slide. So these are some quick slides. You guys can have a look at it later also, how you can donate and contribute for this cause and help us get be more stronger to help our people back in Orissa. Next slide. Yes. So saying this, I would like to go to the main topic, why we are here. That topic is going to start, and I will request Dr. Sangeeta Pradhan to take the mic from now.
Sudhura Americaru, OSA Health and Wellness तरफरु मोर समस्तंको आंतरिक नमस्कार. आमर आज हला 4th सीरीज एटा जो आमे आरंभ करथिलु बेसिकली समस्तंको राइट इन्फॉर्मेशन दबा को चेष्टा करूछु. एथिपाई आमे फिजिशियंस आनिचु थ्रू आउट द वर्ल्ड. आजिरो स्पीकर आमर होचंती हेड ऑफ द डिपार्टमेंट डॉक्टर जयंत पंडा. सीए हमको आज कहिबे जोटा एबे पूरा एकदम गोटे हाहाकार मचैछि ओडिसा रे जोटा कहउचंती ब्लैक फंगस म्यूकोरमाइकोसिस ता उपरे कहिबे. तापरे आसीबे डॉक्टर सुभाष प्रधान. He is an adult psychiatrist in United Kingdom. सीए तांकर प्रेजेंटेशन देबे मेंटल हेल्थ उपरे. तापरे आमे सबले चेष्टा करूछु आ गोटे पर्सपेक्टिव आनिबा पई. आ आजिरो आ गोटे इंटरेस्टिंग पर्सपेक्टिव हला physician side of the picture. Can we go to the next slide? So इथरे हमरो इन्फॉर्मेशन रहिछि मीटिंग रो यूजर आईडी पासवर्ड आ आमे एटा सब बेले सब सैटरडे ए टाइम रे चेष्टा करिबु जे पर्यंत हे पारिबो till this calamity is over. Can I have the next slide please? हमरो थर्ड स्पीकर आज हेबे डॉक्टर निहा जेना. See the perspective from the physician side, and there is also a surprise element to it. Next Saturday रो topic होची बहुत interesting. आमे सब बेले चेष्टा करछु कवर करबा पई विभिन्न perspective, and next one will be women's health in this situation. स्त्री लोक मानक ऊपर कोन इफेक्ट पड़ची physically, mentally, socially, and how we can help that. So having said that, we are all in this together and we will fight it out. And let's get to our esteemed speaker, Dr. Panda. While we are waiting, eta sarla pore, we'll open the floor to question answers.
So thank you, Sangeeta ma'am. Thank you, Devashish. Thank you, all my friends from America, the Odisha Society of Americas, the Health and Wellness Group, for serially conducting the updating programs and getting so many people clear in their mind. I'll be happy to take as many questions as possible from black fungus and other related problems of this dreaded pandemic. Without much delay, I want to start. Should I share my slide? It's there.
We got it, sir.
Yeah. Fine. So this is a few facts about this dreaded disease, the black fungus. Black fungus कहले हमें बुझू कला फिम्पी. अपन जानिले आश्चर्य हेबे नेचर रे गुडाए फिम्पी थांती आपण गार्डन कहंतु मॉश कहंतु सॉइल कहंतु कंस्ट्रक्शन साइट्स कहंतु सेठी सब फंगस थांती जो फंगस माने यूबिक्विटस आमे तांको सैप्रोफाइट्स कहिथाउ बा अपॉर्चुनिस्ट कहिथाउ आपणकर देह रे जदी बळ अछि ताहले से माने आपन को जमा टच करिवेनी आपन जो दुर्बल ही पड़िबे इम्यूनो कॉम्प्रोमाइज्ड ही पड़िबे बा किछि रोग रे आक्रांत हेबे जेमति कि डायबिटीज आपनकर कंट्रोल नाही बहुत हाई अछि डायबिटिक कॉम्प्लिकेशन अछि आमे देखु जे सेमान को ब्लैक फंगस अटैक करे मेडिकल भाषा रे दिस इज म्यूकरमाइकोसिस तो आज बहुत क्विकली मु किछि फैक्ट कहिबी जहारा बहुत डाउट आपन क्लियर कर दबो देन विल टेक अप क्वेश्चंस ए जो म्यूकरमाइकोसिस बा ब्लैक फंगस जोटा कि हमें वर्तमान कोविड बैकग्राउंड रे स्केयर्ड अछु या विषय रे एटा फंगल इन्फेक्शन ते मेनली इफेक्ट करूची लोकन को जो माने चिकित्सा रे अछंती बट साइनसेस और lungs of such individuals get affected after fungal spores are inhaled एकमात्र प्रवेश रास्ता हला निश्वास प्रश्वास इसमें जो माने मास्क पिंधु नाहंती बा those who are not caring for the COVID appropriate behavior they are more prone you inhale the spore goes to the nasal part or the lungs और सेठी से inoculate हुए तो कौन हमर लक्षण सब देखा दिए what are the warning signs and symptoms आखी फुली जाए लाल पड़ जाए नाक फुली जाए लाल पड़ जाए यूजुअली रेडनेस एंड द पेन ऑफ आई एंड नोज और ता साथरे आखी पत्ता मध्य पड़ जाए ज्वर आसे मुंड बिंधा हुए काश हुए धई सई लगे बेले बेले रक्त बांती रे पड़े और लोक बाउली चाउली होती एई सिचुएशन रे जदी देखिबे आपण गोटे पटर नाक इफेक्ट हेची बा गोटे पट नाक बंद होची गोटे पट आखी इफेक्ट हेची बा आखी पत्ता पड़ी जाउची तले मोर लाइकली दिस इज ए सिम्पटम ऑफ ब्लैक फंगस सबु लोक जो मानकर आखी नाक बथा होची बा मुंड बथा होची त ब्लैक फंगस नुए काहे ना वर्तमान हम देखुछु अनेक लोक डरी की फोन करूचंदी आगे मोर आखी बथा होची नाक बंद होची इज इट ब्लैक फंगस वी आर गेटिंग हंड्रेड्स ऑफ पीपल इन द ओपीडी thinking they are suffering next slide so ei situation re ame dekhiba je ame ko mananku ei risk thae risk prothome mu kahi deichi diabetes jo manankar नियंत्रण रे न थाए there are many people who are diabetic around जदि आपनकर डायबिटीज नियंत्रण रे अछि आपनकर कॉम्प्लिकेशन हो ब्लैक फंगस हो ता सब बेले कंट्रोल रे आसीबो यू आर नॉट एट रिस्क काहेकि ना कोविड पूर्वरु आमे जेते ब्लैक फंगस पेशेंट देखिचु रिपोर्ट करिचु से सब गुडा को डायबिटिक बैकग्राउंड रो और से माने यूजुअली कंट्रोल रे न थांती इम्यूनो सप्रेशन बाय स्टेरॉइड्स तो जो माने स्टेरॉइड भले बटिका खाउचंदी बा मेथोट्रेक्सेट खाउचंदी बा आजाथायोप्रिन खाउचंदी गुडाए कैंसर केमोथेरापी नौचंदी बा निजर रोग प्रतिरोधक शक्ति कमेला भले औषध नौचंदी से माने मध्य प्रोन अछंदी तो हम कोविड कॉन्टेक्स्ट रे वर्तमान तीनोटी रिस्क फैक्टर हमें पाई गले प्रथम रिस्क फैक्टर हला कोविड जो माने को कोविड हेतिला बा हेची सेकंड हला जो मानकर ब्लड शुगर भलो भाव रे कंट्रोल नाही और बहुत हाई रहउची और थर्ड रिस्क फैक्टर हला जो माने कि हाई डोज रे स्टेरॉइड पाउचंदी और बेसी दिन पे स्टेरॉइड पाउचंदी और से मानकर कोनोसी टाइमली प्रिकॉशन ए जो स्टेरॉइड थेरापी पई हो कि शुगर कंट्रोल पई हो नाही तो तीनोटी जतले मिसई देउचंती कोविड डायबिटीज और स्टेरॉइड सेटा प्रीडिस्पोज करूची ब्लैक फंगस को तो जो माने बेसी समय आईसीयू रे रहउचंती 2 सप्ताह 3 सप्ताह दरकार होउची जो मानकर ऑर्गन ट्रांसप्लांट अछि बा मैलिग्नेंसी अछि जो माने विभिन्न औषध खाउचंती से माने मध्य एट रिस्क अछंती इन्फेक्शन पई नेक्स्ट तो एथि हमें देखिबा जे हमर प्रिवेंशन बा ए रोग न होबा पे कोन हमें फॉलो करि परिबा सबटु इंपोर्टेंट हला हमें मास्क पिंदिबा जेटा कि बारंबार को होउची दूरता रखिबा कथा हाथ धोइबा कथा और मास्क पिंदिबा कथा मास्क गोटाए जिंस जो जहा कि कोविड भूताणु को मध्य आपन नाकरु प्रवेश करिवारु बंद करि परिबो और ए म्यूकरमाइकोसिस को मध्य आपनकर नाकरु पशिवा पई बंद करि परिबो ता छडा जो माने फील्ड रे काम करूचंदी जेमति कि घर तयारी होउची बा गोटे रियल एस्टेट एरिया बा गार्डनिंग करूचंदी बा विभिन्न प्रकार सॉइल कंजर्वेशन वर्क करूचंदी मॉस रे बा गोटे खेत रे काम करूचंदी सेमानक पई इंपोर्टेंट हला से माने शूज पिंदिबे लॉन्ग शर्ट्स पैंट्स पिंदिबे किछि नहले ग्लोव्स निहाती पिंदिबे ग्लोव्स आउ मास्क जदि पिंदिचंदी निहाती भाबरे से माने प्रोटेक्टेड रहिबे एई कंटामिनेशन रो और जो माने स्पेशली मैन्योर और सारो विभिन्न प्रकार हैंडल करूचंदी तांकर मध्ये सतर्क रहिबा दरकार पर्सनल हाइजीन जेमति कि बगीचा रो आसला परे स्क्रब रे हाथ धोइबा गाधेइबा यह भी इंपोर्टेंट काइना या जदि करिबेनी ताहले आपनको एटा इफेक्ट करि पारे नेक्स्ट आमे वर्तमान देखिबा जे आमे संदेह केतेबेले करिबा मो आपन कहि दैछि कोविड डायबिटीज और स्टेरॉइड आईसीयू रे जो माने बेस दिन रहिले नाक बंद प्रेजेंट कले जोटा कि आमे साइनोसाइटिस लाइक प्रेजेंटेशन कहू नाक बंद हवा कंजेशन हवा नाकरू कला पानी बा लाल पानी बाहरिबा नाक आखि बथा हवा ओ बेले बेले गाल मध्य बथा हवा तो गोटे पट मुह बथा हवा बा फुली जिबा आ नाकरू कला पानी बाहरिबा हमर साधारणतः संदेह होइथाय जे हमें ब्लैक फंगस बा म्यूकोरमाइकोसिस रे पीड़ित अछि नेक्स्ट एबे देखिबा जे आमे को लक्षण सब को देखिबा प्रथम हला दांत बथा हवा बा दांत हलिबा लूज हे जिबा हमरो ज बथा हवा ता छडा दीटा देखा जिबा हमरो नखरे हो कि बा हातरे हो थ्रोम्बोटिक एपिसोड्स बा नेक्रोसिस देखा जिबा जोटा कि हमें एस्कार कहि थाउ आ आखी पता पड़ जिबा आखी बथा हवा ता छडा हमरो चेस्ट पेन प्लूरल इफ्यूजन हिमोप्टिसिस ता माने कफरे रक्त पड़िबो छाती रे पानी जमी जिवो छाती बथा हबो आ धइसई हबो कोविड रे मध्ये लोक धइसई होइतांती एई ब्लैक फंगस रे मध्ये लोक धइसई होइतांती तो सही परिस्थिति रे हमकु नजर रखियो पड़िबो तले कोविड रोगी आईसीयू रे बहुत समय चिकित्सा होउचंदी शुगर कंट्रोल नहीं स्टेरॉइड पाउचंदी सेमानकर धइसई ब्लैक फंगस जोगु मध्ये हेइ थाई पारे से जगह रे हमें एम्फोटेरिसिन देई तांकु चिकित्सा करियो पड़िबो नेक्स्ट तो नेक्स्ट इंपोर्टेंट जिंस हला कोन करिवे आ कोन करिवे नहीं जदि आपनकर डायबिटीज थाए निहाती भाबरे रक्त शर्करा को नियंत्रण करिवे जदि शुगर कंट्रोल रे नाही ताले आपनकर रिस्क बेसी आ ब्लड ग्लूकोज मॉनिटर करिवे पोस्ट डिस्चार्ज आपन जदि कोविड रे डिस्चार्ज हेतांती घरे 3 दिन रे हो बा 7 दिन रे हो रक्त शर्करा नियंत्रण करिवे जेमिति 200 तळ को रहइबो 130 रु 150 हला ठीक रक्त शर्करा मैक्सिमम हमें 180 जाय ग्रहण करि परिबा खाली पेट रे हो बा खाइबा परे हो जदि से 180 ऊपर को गला बा 200 ऊपर गला निश्चित भाव रे ता ठीक भाव रे नियंत्रण हेइ नाही जेतले हम स्टेरॉइड व्यवहार करूछु किछि दिन पय व्यवहार करिबा जेमति कि 5 दिन 10 दिन मैक्सिमम एहा जीवन बंचै थाए किंतु ताहा इन्फेक्शन करेबार संभावना रखि थाए यदि हम स्टेरॉइड को बिना रेगुलेशन रे व्यवहार कलु ताहा लाभ अपेक्षा बेसी क्षति करि पारे तो सठिक टाइम रे आरंभ करिबा सठिक डोज रे सठिक दिन पय खाइबा और सठिक समय रे बंद करिबा ताहा बहुत गुरुत्वपूर्ण क्लीन वाटर यूज करिबा स्टेराइल वाटर यूज करिबा जतले हमें ऑक्सीजन थेरेपी दोउचु बा ह्यूमिडिफायर यूज करूचु घरे एयर कंडीशन जो मानकर नाही कने से पानी रे बेले बेले फंगस ग्रो करथंती आ गोटे जिंस भी देखा जायछि जे आईसीयू रे क्रिटिकल केयर सेटिंग रे बहुत इरेशनली हमें एंटीबायोटिक व्यवहार करथाउ छोटिया प्रॉब्लम हेले भी बहुत ब्रॉड स्पेक्ट्रम एंटीबायोटिक बहुत दिन जाय व्यवहार करथाउ एंटी फंगल मध्य व्यवहार करथाउ मन रखियो दरकार कोविड गोटे बैक्टीरियल डिजीज एठी एंटीबायोटिक हाई पावर रो दरकार नहीं कोठी दरकार नहीं बिल्कुल दबानी ओ ठीक समय रे बंद करिबा काहे कि ना जदि हमें बहुत दिन धरि एंटीबायोटिक दो गट फ्लोरा कमी जिवो ओ इम्यूनिटी मध्य कमी जिवो नेक्स्ट आमे कौन करिबा नहीं हमर जते बेले आखी बथा होउची मुंड बथा होउची नाक बंद होउची बा कला पानी बाहरुची रक्त बाहरुची हम ताको नेग्लेक्ट करिबा नहीं निश्चित भाव रे नियरेस्ट डिस्ट्रिक्ट हेडक्वार्टर हॉस्पिटल रे और मेडिकल कॉलेज रे ताको परीक्षा करे नबा आमे जेते बेले नाक साधारण भाव में बंद होउची जो मानकर एलर्जी अछि आस्मा अछि छिंक होउची सेई सबु केस रे भयभीत हबा नहीं जे हमर साइनोसाइटिस हे गलानी बा ब्लैक फंगस हे गलानी ओ आमे विभिन्न रोग रे पीड़ित हे गलानी आमे जेते बेले इम्यूनोसप्रेसिव्स आ इम्यूनोमोडुलेटर्स खाउछु आमे यथेष्ट भाव में सतर्क हवा कथा अजथारे भयभीत न होई ठीक लक्षण रे ठीक समय रे डॉक्टर पाखु जिबा दरकार आमे हेजिटेट करिबा नहीं जहाँ भी परीक्षा हबो हमरो केओएच स्टेनिंग हुए माइक्रोस्कोपी हुए कल्चर हुए आ जो फंगल डिटेक्शन जहाँ दरकार हुए टाइमली करिबा आमे जो टाइम दरकार चिकित्सा पाई ताको लूज करिबा नहीं जेतलो दरकार मेडिसिन खाइबा जेतलो दरकार ऑपरेशन पाई जिबा जेमिति कि जीवन बंची जिवो काहे ना बेले बेले एटा बढ़ी गले स्पेशली द राइनोसेरिब्रल म्यूकोरमाइकोसिस जोटा कि नाक आ ब्रेन रे ही थाए ता जदी बढ़ी जाए ता लोक अचेत ही जानती बात मारे ओ रोग जोगु मृत्युवरण करिवार मध्ये रिस्क थाए ता छडा हमर श्वासनळी आक्रांत होई पारे फुसफुस आक्रांत होई पारे खाद्यनळी आक्रांत होई पारे हमर स्किन आक्रांत होई पारे ओ डिसेमिनेटेड बा ए सबु ऑर्गन मध्ये आक्रांत होई पारंती नेक्स्ट तो मैनेजमेंट विषय मु आ गोटे मिनिट नहीं मो प्रेजेंटेशन सारिबी मु निश्चित जे आपण मानकर भितर बहुत प्रश्न थिबो आमे ताकु नबा आमे डायबिटीज कंट्रोल करबा निहाती दरकार और जो मानकर डायबिटीज बढ़ी कीटोएसिडोसिस अछि ता निहाती भाव रे कंट्रोल करबा दरकार जोठी कि रोगी डिहाइड्रेटेड हे जानती पेट काटे धइसई होंती ओ तांकर चिकित्सा और सुगर नियंत्रण निहाती दरकार काहे नै कीटोएसिडोसिस पेशेंट बा कमांड के डायबिटिक कीटोएसिडोसिस कमा निहाती भाव ब्लैक फंगस रे आक्रांत होइथांती स्टेरॉइड आमे ठीक टाइम रे बंद करिबा 5 रु 10 दिन दे जो माने बेसी दिन खांती से मानको मॉनिटर करिबा आमे ब्लैक फंगस पई जदी निहाती दबा दरकार थाए कोनोसी प्रकार एंटी फंगल बा एंटीबायोटिक प्रोफाइलैक्सिस दरकार नै अनेक लोक आसी पचारचोंदी हमको मेडिसिन दियंतु आमे ब्लैक फंगस रक्षा पाया पई चाहूचु जेमि न हो से चाहूचु किछि दरकार नै हमर आपनकर हाइजीन दरकार ग्लोव्स और मास्क दरकार शुगर कंट्रोल दरकार और स्टेरॉइड बंद करबा दरकार नेक्स्ट तो आमे लास्ट प्रेजेंटेशन को आसी जाइछे हमरो बेले बेले एक्सटेंसिव सर्जिकल डिब्राइडमेंट दरकार हुए आपण मन रखंतु केवल जे मेडिसिन द्वारा भलो हबो ताहा नुहे आमे एम्फोटेरिसिन दो पोसोकोनाजोल दो बाकी सपोर्टिव मेडिकेशन देई थाउ किंतु आई सर्जन और ईएनटी सर्जन को हेल्प दरकार हुए डिब्राइडमेंट दरकार हुए कांगना नेक्रोटिक मटेरियल बहुत हमरो आखि भितरे नाक भितरे और ब्रेन भितरे जमी जानती आमे सेही पेशेंट मानको पेरिफेरली इंसर्टेड सेंट्रल कैथेटर देई थाउ एडिक्वेट हाइड्रेशन मेंटेन करि थाउ और नॉर्मल सलाइन आईवी दो एम्फोटेरिसिन भी दबा पूर्वरु और एंटी फंगल थेरेपी एटलिस्ट जोटा कि मासे रु 1.5 मास जाय दिया जाए ता बहुत गुरुत्वपूर्ण तो आमे जानिले ब्लैक फंगस कोन को मानकर रिस्क अछि को माने विपद रे अछंती आमे कोन करिबा और कोन करिबा नहीं तेनु समस्ते भयभीत हवा दरकार नहीं जो मानकर नाक बंद होउची जो मानकर कोविड रु रक्षा पाइचंती और शुगर बेसी अछि आ स्टेरॉइड खाउचंती से माने जदी नाकरु कळा पानी बाहरे बा रक्त बाहरे सिवियर हेडेक हुए बा गोटे पटर आखि पता काटिबा नाक काटिबा आखि पता पड़ी जिबा देखा जाए निहाती भाव डाक्टर को जोगाजोग करिवे न होबा पई स्टेरॉइड इरेशनली मने मने खाइबे नहीं आउ ब्लड शुगर को कंट्रोल रे रखिबे तो मोर एई जो प्रेजेंटेशन पई और आपन समय पई आई एम थैंकफुल टू ऑल ऑफ यू एंड आई विल बी हैप्पी टू टेक अप क्वेश्चंस थैंक
you Dr. Panda for the excellent presentation बहुत भलो इन्फॉर्मेशन हमको समस्त को मिलिला बॉटम लाइन हला जे पैनिक हेबे नहीं सो आपन को डॉक्टर संगे कथा हेबे आ जदी आपन को खाली डायबिटीज अछि किछि व्यस्त होवा दरकार नहीं पैनिक न हवा पई नेक्स्ट फेज आमे जिबा टू टॉक टू आवर नेक्स्ट एक्सपर्ट डॉक्टर सुभाष प्रधान डॉक्टर प्रधान
नमस्कार मु अपेक्षा करू मोर स्लाइड पैंकी
Can I ask a quick question in between?
So
questions we are taking in the end. The presentation is Sardaba. Please hold on. There are other people also who have posted question in Facebook Live and raised hands.
Yeah, both questions achi we'll address that.
Yeah, I will definitely take your question. Thank you.
Thank you. More slide go wait koruchi. But first of all, until the slide comes, thank you everybody. Thanks specifically Odisha Society of America Health Wellness Group and ODIA International Doctors Association. That's really giving me this opportunity. आपनको कथा तो करिया पे कि गोटे सुजोग मिलिछि मत कहया पे कि मोर मो स्लाइड मो एपन वेट करूछि एटा आसिनि एठी हमें ए देखिया पड़े मोर ए टॉक मो एभला एमती करिछि जे सब संभव नुहे ए 5-7 मिनिट भितर कथा करिया पे कि मो सतमे कि फोकस करूछि जस्ट गोटिए एस्पेक्ट ऊपर एटा हला जो ग्रीफ जो बहुत लोक हमें देखुछे हमर समस्त डायरेक्टली इनडायरेक्टली अनुभव करथिबे तांको फैमिली रे कहार मामला कहार ध्यान पे जाछि कि कोमानकर तांको छाडी चले जाइछंती ओके एई अवस्थाटा को केमिति लोक माने अनुभव करूछंती ओके सो से स्टेजेस ऑफ ग्रीफ ता विषय रे मोइटे कहबी तापर को आउट अलगा क्वेश्चन गुडा को हमें क्वेश्चन आंसर सेशन रखिबा फॉर एग्जांपल क्वेश्चन ऑन चिल्ड्रन्स मेंटल हेल्थ and long psychological consequences of COVID. So that's why I'm taking including some aspect of the psychological first aid. All right. So this Shabda T. Mate bhal lagila. Shabda artha sound, nahi ki. So Shabda stands for is an acronym. Devasis kotle mate kuch acronym rakha lokko man rakhe api easier rahibo. So that's really fair. I mean that way. So Shabda stands for SABDA. Okay. Next slide. Dekhe ki mate. Before I go to actually define it, गोटे केस कहया को चाहूची तो प्रथम प्लान थिला सब्यसाची विषय टिके कहि बोली कारण से गोटे केस डिस्कस करथले मो मन रे एक्चुअली बहुत ता विषय टिके भाबिली से कहथले जे कि जन यंग डॉक्टर थिले से तांका मां कोविड रे पीड़ित हितले सो तांका प्रॉब्लम होला तांको एडमिट करा पे डिफिकल्टी होतला सो से सब्यसाची कर टिके हेल्प ना को चेष्टा कले किंतु इन द मोमेंट तांको जो बेड अरेंज हितला आनिला बेल को रास्ता रे apparently she passed away, mother. But that information Sabyasachi probably didn't have it. So a day later, apparently, when he calls, there was a surprise for him, basically. The doctor who was there, he said, well, my mother is not there, but so also my father who was affected. So these are almost same time, death what surprised Sabyasachi was while he was telling very nicely is that the person didn't have any emotions. He said, see, I can't feel anything. Both my parents have died and I feel as if normal. What's happening with me? Is it abnormal? Am I not a right person, not a right son? Am I a human being? Okay. So this is the small case vignette. Everybody can relate to it in one way or other. We'll be discussing about it. Okay. Next slide of the country. So, এই কথা কহিয়া पे कि हम कोन करबे जो ग्रीफ रो पांचटा स्टेज थाई को जे पांचटा स्तर जोटा को जाय there is somebody called Kubler-Ross a psychiatrist से तर extensive तांकर रिसर्च करथि तांकर PhD thesis तलाई विषय and this is very very accepted theory ए पांचटा स्टेज विषय जे प्रथमे कोन होय लोक माने शॉक और डिनायल फेज रे होंती जेंति डॉक्टर थिले केसम पर जणा पड़िबो नै कोन होउची बोली okay. This is very important for people, those who are field re काम करूछंती कि those who have been affected. So when they go through the stages, आपण एते मन रखिबे, then you can relate to them better way. All right. So shock denial phase रे आपण जणा पड़िबोनी कोड कोन होउछ बोली ता पर गोटे फेज आसे anger रो रागी की बोल जानला पर को somebody must be responsible. आपण मन सुनथिबे वो डॉक्टर को बाड़ेबा मारिबा भगारोजा करिबा many people do in this stage. Suddenly जानले आउ किछ इमोशन नाही suddenly anger आसला immediately when the body is even there they go and hit the person. All right. So this is another stage, normal stage of what do you call people going through grief. Ta पर stage ताला bargaining टिके आपन जणा पड़ी गला कोन कोन होउची बोली सेते बळे आपण तक बार्गेन करिवे भगवान सहित का सहित बार्गेन करिवे ओके एटा पूरा क्लियर हबो नेक्स्ट स्लाइड रे किंतु मु कहि देखि दउ चाउड नेक्स्ट जला डिप्रेशन acceptance आमे नेक्स्ट स्लाइड को जावा सेते टिके भलो हबो मु सेते कोन कहू ओडिया रे भी लिखि देछि this is your carry home slide if at all you carry something so every presentation has a carry home slide okay so ई पांचटा डिवीजन मु टिके को डिस्क्रिप्शन कहिछि प्रथम दोला शॉक एंगर मु कहि देली शॉक एंड डिनायल आश्चर्य हे जिवे चकित हे जणा पड़नी कोन अछि बोली आपण इमोशनली नम भई पड़ले जानि पड़ले कोन कोन इमोशन चलछि बोली ऑलराइट तापर हला जो एंगर स्टेज रे जो कहली रागी की this frustration over unfairness. Oh, I'm more mother came why not me? Why not someone else? All right, set out rahila. Ta phira ko blame same jo mo koithile eta ko seta he paribo boli. Jo stage re bahut lok asanti. I mean from time immemorial apun dekhantu from Mahabharata ro joti ho anger has created more problem than it has solved, isn't it? So seta rahila. Ta pur ko apun asila bargaining stage. Bargaining re se bujhamana negotiation stage re koithibe भगवान कौन दे बोले I mean जो कौन दी bribe करे अपने गार्ड को अब वो ये दे दो ची मते बहुत लोगों को फेरे दियो okay something like that very very irrational plan like aji to bring the dead back है ना जमराज को धर की पड़े आसीबे से बोलिया से मैंने गोटे व्यवहार करंती लोको okay तापर स्टेज रे once they realize bit of reality many people go through depressive phase उदासीनता जो फेस कोंथली से अपन से जीवे कितले कौन हुए ना धीरे धीरे से मानकर होपलेस ही पड़ती वेल जहाँ इची पचरे पास्ट प्रेजेंट फ्यूचर हम फेमस गोटे बैक ट्रायड को जाता को आराम ब्रेक रो ट्रायड अछि दे पास्ट टाइम मोर खराब थिला वर्तमान भी एमती अछि फ्यूचर भी किछि आशा नाही होप नाही ओके सेटा हला गोटे क्लासिकल फेज रे हुए एंड नॉर्मली सेटा हुए दिन पई की एंड सेतरे कोन हुए आपनकर डिटैचमेंट पोजीशन रे इंटरेस्ट रहला नै लोको बोले सुसाइडल थॉट आसिला सम पीपल अटेम्प्ट सुसाइड हम टिके डिस्कस करबे ता हमें पैथोलॉजिकल ग्रीफ विषय पहला को ओके से फेज ता ओटा डिप्रेशन फेज तापर फेज ता हला एक्सेप्टेंस फेज दे दैट टाइम they somehow come to near almost normality a grief phase देखंतु okay how long it will take we'll discuss about that सेतरे कोन करूछन से माने रियलिटी को एक्सेप्ट करूछंती and many people go to accept the reality and live so far as possible in normal life okay but not everybody can I have the next slide please समस्त निहंती तो कौन हुए some people persist in this stage for a long time depression persists without accepting it all right ए स्लाइड टा गोटे कोन आपन ग्राफिकल रिप्रेजेंटेशन करूची केमती से स्टेज ता डिफरेंट फेज आउची बोली ओके यू नॉट स्पेंड मच टाइम ऑन दैट हमें नेक्स्ट स्लाइड के देखंतु ए नेक्स्ट स्लाइड रे हम कोन कहूची ये गोटे ए बिटा पे टेक्निकल स्लाइड प्रथम बहुत देबी नै बोली किंतु आपन जानिया दरकार मैं पैथोलॉजिकल ग्रीफ कोंती जोटा को कोठू हमें ट्रीटमेंट दवा केते बळे ट्रीटमेंट को इनिशिएट करिया पड़िबो ओके जेते बळे जो पीरियड टा ए ग्रीविंग पीरियड जो कहा जाए बेरीमेंट मोर देन 6 months to 1 year and there are some pathological changes like some people become suicidal some people persistently remain angry and dissociated ता निजर डे टू डे फंक्शनिंग करि परिबे नै ओके ता किछि मेजर माइनर क्राइटेरिया अछि DSM-5 रो DSM-5 is considered the bible in psychiatry and ICD and also हमें एगुडा को डिस्कस करबा नै ओके किंतु मेन कथा हला हमें सेते बळे इंटरवेन करबा जेते बळे एटा पैथोलॉजिकल दिगरे गति करछि देखिया बोली हमें मु अर्थ जो स्लाइड हमें कथा करथले हमें डिस्कस करथले जे केते बळे हमें साइकोलॉजिकल हेल्प नवा जेते हमर फंक्शनिंग सोशल ऑक्युपेशनल पर्सनल फंक्शनिंग इंपेयर हे पड़ुछि ऑलराइट सेटा से पर्यंत विल नॉट ट्रीट इट इज नॉट ए मेंटल इलनेस मन रखंतु ऑलराइट दिस इज ए पार्ट एंड पार्सल ऑफ द नॉर्मल ह्यूमन एक्सपीरियंस आवर जॉब इज नॉट टू ट्रीट नॉर्मल ह्यूमन एक्सपीरियंस नेक्स्ट स्लाइड
सुभाष जो फंक्शनिंग पैथोलॉजिकल कल तो टिके एक्सप्लेन करिवो मैं नॉट doing the things that you get pleasure माने बाहर को जिबा पे तुमको इच्छा होनी खाया पे की इच्छा होनी कैन यू एक्सप्लेन इन कॉमन मैन्स
एग्जैक्टली आई थिंक दैट्स अ वेरी गुड पॉइंट वासी देखंतु सेटा मेन कथा होची दी प्रकार अछि गोटाला जे ए जो ग्रीविंग फेज ता जदी परसिस्ट करिवो वर्ष पर्यंत सेवेला रहिबो फास्ट जो 15-20 दिन कोहंती दिस वेरी इंपोर्टेंट स्पेशली कारण हमर जो नेचुरल रिएक्शन अछि फॉर एग्जांपल हमें कोन करूए जो रिचुअल करे लाइक देहांत हुए 14 दिन पर जो हुए एगुडा सब आजिकली बहुत जिनस मना कराइछि isn't it because of the social restrictions and covid fear पे की मना कराइछि तो सेट में नॉर्मल एक्सप्रेशन ऑफ द ग्रीफ पेपर नहीं so many people are likely to have pathological consequences of that mostly them कोन करा जाए जो पर्सनल फंक्शनिंग रे he is not able to function in his own role for example तार निज ता रोल अछि as a husband as a father as someone else is not able to function significantly he's not able to function in his job in occupation as a student constantly he cannot focus on that and that persists for more than say 2-3 weeks it persists kala those are the points you have to think about something has to be done it's not normal all right next slide please हमें ठीक है थोड़ा डिस्कस करिया आउट भलो करी जो अलगा डिस्कशन हमारे देखो
क्वेश्चन एंड आंसर बड़े करिया सेटा
या श्योर the main task of grief ta kahi darkar ho jaye okay सेत पे कि जे to accept the real, this is a teardrop model what a second T stands for to accept the reality of loss. Okay, both look reality को accept करी पारंतनी, the true grip कोन देदा को from a philosophical perspective एटा हुए नहीं लोगों, that is important. Second is to experience the pain of loss. Remember, pain has got an educational lesson that has to be learned, and that is essential. Some people, जो mental illness होची, schizophrenia, something else, they can't grieve properly, and that has its own consequences. There is something called as delayed grief. So you think that is mental illness? No, it could be the grief that he hadn't had it. So our job is to facilitate that as the frontline workers, grassroots level. We have to know that this person hasn't grieved. Well, that is something pathological. All right, not grieving. Third is about to adjust to the new. It is very important. Last two, adjust to the new environment without the person, the lost person basically. Obviously, you cannot adjust completely 100% acceptance. Sometimes we all know that near and dear one galapore, but to a reasonable extent, we are able to do our functioning. All right, that is one of the tasks of grief. And I would not only that, you adjust, you reinvest, means you prosper, you progress from that point onward. Okay, this is very brief. Our role essentially, our role we are not an active person here. We're not changing something. We're only facilitating grief. Okay, next slide, please. Summarize koruchi. Okay, last two slides only. Summarize koruchi. Very 3 sentences. Grief is universal. Okay, এটা universal ODIA हम कर जानी समस्त हुए এটা हमें समस्त grief रे जीवा. All right, and ये गोटे pattern follow करे. मुझे रखो इला अपन शब्द विषय रे. More or less, I mean obviously कार अधिक दिन रहो कार कम रहो, but it pays to know that pattern, especially for the workers, especially for the family members. And ये गोटे our trajectory नहीं पड़े पिला मानक पे की. Almost similar pattern with some sort of differences. We might touch upon it if the question comes. Okay, next time, Ray. And our job is mostly to facilitate it, not to intervene. All right. So next one, I'm going to reference interest. I'm sure that's one forward including World Health Organization model psychological fast aid PFA. Okay. So the last one, my last slide, next one, please. I leave you with this quotation. All right. It's a very small quotation. The helping someone might not change the whole world, but it could change the world for that one person. So I will leave you with this quotation, the thing that how you can be that change. And thank you once again, OSA and ODIA for allowing me this opportunity. And I will be question answer and other resources. Thank you.
Thank you, Dr. Pradhan. Excellent quotations, excellent presentation. Kintu खाली आमे स्पीकर रहिले कि ऑर्गेनाइजेशन रहिले काम हुएनी सेति पई डाक्टर को दरकार पेशेंट आ पेशेंट हेले आपण माने खाली सब बेले भाबंतुनी जे खाली फिजिकल हेल्थ ता इंपोर्टेंट ब्रेन जोटा कि हमरो कंट्रोल नाही ता ऊपरे सेटा भी बॉडी रो गोटे बहुत इंपोर्टेंट पार्ट आ मेंटल हेल्थ इलनेस को केबे भी गोटे टैबू भाबिबेनी केबे भी सेटा एक्सप्रेस करले किछि खराब नाही फर्स्ट हला आमे एक्सेप्ट करबा दरकार एंड वंस वी एक्सेप्ट इट then only we can go for treatment and feel better and make the world a better place. Now having said that, amaro ei sabu kamare bahut gode unsung hero bi rahichanti and organizations achanti jota ki help karuchanti volunteers darkar ethi pai amaro obviously hero achanti ethi apan dekhibe but unsung hero emti bahut gode organization achi amaro माने volunteers सब काम करचंदी थ्रू आउट जोटा कि हमें जानू ने भी कोविड असिस्टेंस volunteers अछंदी ट्विन सिटी रो से मन बहुत गुडे मेंबर्स तांकर आज एठी अछंदी so all those things make a big difference. Having said that, let's move to the next segment. Dr. Nihar Jena, who is going to present what goes on in the doctor's mind.
Thank you, Rani. समस्त को नमस्कार जो माने देखु जंती लाइव फेसबुक रे आ जो माने जूम रे अछंती रश्मि से स्लाइड टा प्रेजेंट करियो सो एथे गोटे बहुत भलो कोटेशन अछंती देखंतु गोटे बहुत भलो पिक्चर भी अछि सो रियल हीरोज वेयर मास्क बिलो देयर आईज सो लाइक एटा गोटे बहुत कैची लाइन तापरे आपण माने देखि परिबे कि सबु डाक्टर सबु हेल्थ केयर वर्कर इट्स नॉट ओनली अबाउट डाक्टर बहुत हेल्थ केयर वर्कर जो माने अछंती नर्सेस पैरामेडिक्स ସେମାନେ ସମସ୍ତେ ଅନବରତ କାମ କରି ଚାଲିଛନ୍ତି ଏଇ ଯୋଉ ଘଡ଼ିସନ୍ଧି ମୁହୂର୍ତ୍ତରେ। ଆଉ ମୁଁ ଗୋଟେ କଥା ହଉଥିଲି ଏବେ କାଲି ଗୋଟେ କଥା ହଉଥିଲି ମୋର ଗୋଟେ ପୁରାତନ ବନ୍ଧୁ ସାଙ୍ଗରେ, ସେ ଅଛି ନବରଙ୍ଗପୁରରେ। ସିଏ କହୁଥିଲେ କି ମତେ ତାଙ୍କୁ 12 ଘଣ୍ଟାରୁ 14 ଘଣ୍ଟା ପାଖାପାଖି ପିପି ପିନ୍ଧିକି ରହିବାକୁ ପଡୁଛି ଗରମରେ, ଆଣ୍ଡ ସେମାନେ ଅନବରତ ଚେଷ୍ଟା କରି ଚାଲିଛନ୍ତି କେମିତି କେତେଟା ଲାଇଫ ସେଭ୍ କରିପାରିବେ। ଆଣ୍ଡ ସିଏ ତାର ଫ୍ୟାମିଲିକୁ ଦେଖିନି ପାଖାପାଖି ହୋଇଯିବଣି 1.5 ବର୍ଷ ହେଲାଣି ସିଏ ଘରକୁ ଯାଇନି। ତା ଘର କଟକ, କିନ୍ତୁ ସେ ଘରକୁ ଯାଇପାରିନି ବିକଜ ତାକୁ ସେଠି ରହିକିନା ସିଏ ଗୋଟେ ଡାକ୍ତର ସେଠି ସେଇ ଏରିଆକୁ ସମ୍ଭାଳିବା ପାଇଁ, ତ ସିଏ ରହିକିନା ସେଠି ସିଏ ହେଲ୍ପ କରୁଛି। ଆଣ୍ଡ ଆପଣ ମାନେ ଯେତେବେଳେ ଯାଉଛନ୍ତି ଗୋଟେ ପେସେଣ୍ଟ ନେଇକି ଗୋଟେ ଡାକ୍ତର ପାଖକୁ, ସେତେବେଳେ ଆମର ଇମୋସନ ବି ସେଇ ଏକ୍ଜାକ୍ଟଲି ସେମ୍ ଆପଣ ମାନେ ଯେମିତି ଭାବୁଛନ୍ତି। ଆମେ ଯେତେବେଳେ ଗୋଟେ ପେସେଣ୍ଟକୁ ଟ୍ରିଟ୍ କରୁ, ଗୋଟେ ଫ୍ୟାମିଲି ମେମ୍ବର ଭାବିକି ଟ୍ରିଟ୍ କରୁ। ଆମେ ଆମ ଫ୍ୟାମିଲିକୁ ଛାଡିକି ଆସିକି ହସ୍ପିଟାଲକୁ ଭାବୁକି ଆମର ଘର, ଆଣ୍ଡ ଯୋଉମାନେ ପେସେଣ୍ଟ ଆସୁଛନ୍ତି ଆମେ ତାଙ୍କୁ ଆମ ଫ୍ୟାମିଲି ମେମ୍ବର ଭାବିକି ଟ୍ରିଟ୍ କରୁ। ତ ଯଦି କିଛି ଗୋଟେ ପେସେଣ୍ଟର ଅସୁବିଧା ହୁଏ, ଆମେ ବି ସେଇ ସେମ୍ ଦୁଃଖ ପ୍ରକାଶ କରୁ କି ଆମେ ପେସେଣ୍ଟର କିଛି ହେଲ୍ପ କରିପାରିଲୁନି କି ପେସେଣ୍ଟର ସ୍ୱାସ୍ଥ୍ୟରେ ଉନ୍ନତି ହେଲାନି। ତ ମୁଁ ଆ ପର ଯୋଉ ସେଗମେଣ୍ଟଟାକୁ ଏଲାବୋରେଟ୍ କରିବା ପାଇଁ ଆମର ଓଲିଉଡର ସୁପରଷ୍ଟାର ସବ୍ୟସାଚୀଙ୍କୁ ରିକ୍ୱେଷ୍ଟ କରିବି କିଛି କହିବେ ଏ ବିଷୟରେ।
ମାନେ एक्सपर्ट्स माने तांको मुहरु आमे तांको କଥା ଶୁଣିଥିଲା, तांको मुहरु आमे हमर क्वेश्चन रा आंसर गत किछि शनिवार रे आमे प्रत्येक दिन राति रे एठी आमे हमर डाउट को आमे क्लियर करछे। तो सेति पई प्रथमे म एक्सपर्ट्स मान को बहुत बहुत धन्यवाद देबी जे से माने तांकर बिजी शेड्यूल भितरु समय काढी कि हमकु एड्रेस करछन, हमर क्वेश्चंस को हमर डाउट्स को हम मन भितर थिबा भय को दूर करछंती। आ हम संगे हॉस्पिटल भी अछंती, हॉस्पिटल परे एमिति डिजिटल फोरम माध्यम रे भी हम संगे अछंती, जोटा हम मानकर मनोबल को बढ़ौची, जहा पर हमें कोविड को केमिति अधिक सामना करि परिबा, केमिति हमें निजको स्ट्रांग करि परिबा, सेटा पय हमें निजको प्रिपेयर करि परिबा बोली हमको साथ दोचंती। तो हमर एक्सपर्ट्स माने जो माने ओसा हेल्थ एंड वेलनेस ग्रुप एवं ओडिशा डॉक्टर्स इंटरनेशनल एसोसिएशन रो प्रत्येक टी जो एक्सपर्ट्स माने हम पाखरे आज अछंती, ओडिशा भितर अछंती, ओडिशा बाहर अछंती, भारत बाहर अछंती, सब एक्सपर्ट्स मानन को मु हृदय रु धन्यवाद जणेबी। मु जहाँ भी बर्तमान कहिया पई जाउची एटा बहुत जरूरी, आजिका समय रे यार महत्व बहुत अधिका। तो मु चाहिबी जे मते जो माने वर्तमान सुनुचंती, खास करी कि फेसबुक माध्यम रे किंबा अन्य कोन से डिजिटल फोरम माध्यम रे जो माने सुनुचंती किंबा जो माने वर्तमान लाइव वीडियो हमर पोस्टिंग हे सरला परे आगामी दिन गुडे करे जो माने ए लाइव वीडियो को देखिबे, जो माने सुनिबे, से समस्त मु गोटे दिन से रिक्वेस्ट करबी जो कथा वर्तमान मु कहया को जाउची ताकू टिके हृदय रे सहित बुझिया चेष्टा करबे, कारण एटा मात्रा रे आजिका समय रो गोटे नीड द आवर कहि परिबा। वर्तमान ए जो घड़ी संधि मुहूर्तर सबुठु करणीय जिंस जोटा सबुठु निहाती आमे करबा दरकार आज जनरल पब्लिक, सेटा किछि मु कहया पई जाउची। एई किछि दिन हलानी मु लास्ट गोटे मास ऊपर हबो गोटे ऑनलाइन फॉर्म माध्यम रे विभिन्न लोक मानकर विभिन्न प्रकार असुविधा सुविधा को एड्रेस करूची। आ से असुविधा सुविधा को एड्रेस करबा समय रे मु सह सह परिवार सहित कथा होची, सह सह लोक मानक सहित कथा होची। आ से सह सह लोक मानक भितरु बहुत लोक मानकर परिवार जे कि कोविड सहित संग्राम करूची, कोविड रो भयावह रूप को जो माने देखुचंती, अंगे निभौचंती, सेमान सहित कथा होबा सहित सेमान को ट्रीट करथवा डॉक्टर मान सहित भी कथा होची। वर्तमान कहया को गले ओडिसा रो एमिति कोनोसी हॉस्पिटल नथिबो जो हॉस्पिटल डॉक्टर संगे मु कथा ही नथिबी कोनोसी ना कोनोसी पेशेंट को नेकरी। तो गोटे डॉक्टर मानक सहित आ पेशेंट मानक सहित कथा हबार सुजोग मते मिलिछि। समस्त कथा हबा सहित मु सेमानकर मन रे थिबा जो जहाँ भी तांको संगे बितुछि सेगुडा को मु पर्सनली हृदयंगम करि पाउछि। आमे सब बेले पेशेंट मानक कथा आमे सब बेले सुनिचे, पेशेंट कथा आमे सब बेले देखुछि, काना आम आखि आगे घटुछि। आज किए गोटे पेशेंट रो जदि किछि देह खराब हैला, से पेशेंट हॉस्पिटल गला, पेशेंट घर को फेरिक आसला, किंबा पेशेंट हॉस्पिटल भल न होई फेरिला, एगुडा सब तक आम आखि आगे घटुछि। किंतु आम आखि आगे घटुनी कोन, आम आखि आगे घटुनी आईसीयू भितरे कोन होउछि, आम आखि आगे घटुनी गोटे डॉक्टर किंबा गोटे नर्स किंबा गोटे हॉस्पिटल स्टाफ केमिति कोन करूछि, केते परिश्रम करूछि, सेटा आम आखि आगे घटुनी। आमे बेले बेले सोशल मीडिया रे हो किंबा न्यूज माध्यम रे विभिन्न न्यूज देखि रागी जाउछु जे डॉक्टर केयर कलानी कि कोठी गोटे काहा अवहेला हे गला, किंतु से अवहेला होछि कोटिए रे गोटिए। जो केयर दिया होची जो प्रकार डॉक्टर माने नर्स माने तांकर निज परिवार को छाड़ी की निज लोकंकर जीवन को पानी छड़े की निजर जीवन को पानी छड़े की जहाँ हॉस्पिटल ले कहउचंती सेटा बोधे से जो गोटिए जो नेगेटिव न्यूज ता सामने रे दबिबा कथा नुहे एटा पर्सनली मु फील करछि और ता सहित जेहेतु मु डॉक्टर मानक संगे कथा हिची मु सब डॉक्टर के पाखे गोटे जिंस कॉमन फील करछि खास करके इंडिया भीतर थिबा डॉक्टर्स मानक मु कथा कहूछि से माने मेंटली बहुत प्रेशर अछंती से माने मेंटली बहुत माने मते तो लागुछि बोधे अल्प दिन परे आमे हमर बहुत जन डॉक्टर को माने कोविड तो छाड़ू कोविड तो सेमानक भितर बहुत जन डॉक्टर मानक जीवन नहीं साराणी किंतु मानसिक चापर आमे बहुत जन डॉक्टर को आमे हरैबा को जाउछि जदि जने हमको सर्विस दोछि आमे ताकू धन्यवाद न कहि कि जदि ता ऊपर आउरी अधिक दोष लदिबा कि अधिक प्रेशर लदिबा ताले अल्टीमेट पोजीशन आसीबो एमिति सिचुएशन आसीबो डॉक्टर टी बिचारा सी गोटे मनीष सी भगवान नहंती सी तांको पारु पर्यंत चेष्टा करनते केमिति गोटे पेशेंट भलो हो जाऊ आ दुनिया रे एमिति कोनोसी डॉक्टर नथिबे जे तांको आखि आगे कोनोसी पेशेंट को कोनोसी प्रकार असुविधा होतबा देखिबे किबा टॉलरेट कर परिबे तो हमरो रेस्पोंसिबिलिटी एज कॉमन मैन गोटे साधारण गोटे नागरिक हिसाब रे हमर रेस्पोंसिबिलिटी कि आमे अंतत तांकर ए जो सेवा गोटे फ्रंट लाइन वर्कर से नर्स होंतु किबा गोटे हॉस्पिटल स्टाफ होंतु किबा जने डॉक्टर होंतु तांकर जो सेवा पई एटलीस्ट आमे तांको गोटे हस हस मुहरे आमे तांको ग्रीट करबा आ जदी हमर परिवार रे किबा हमर निगर सर्कल रे कोनोसी भी मिसअप घटु आमे कहा ओने को सिस्टम प्रोफेशनल किबा कोनोसी गोटे हॉस्पिटल रे भंगारुजा कहा को गोटे माने मारिबा ए करबा एई सब जिंसो जेमते आमे निजो को दूर रखिबा आ आमे माने जो माने रेस्पोंसिबल नागरिक रेस्पोंसिबल सिटीजन आमे एटा हमर कर्तव्य जे आमे हमर फ्रंट लाइन वर्कर मानकर जत्न नबा से माने हम परिवार जत्न नेबे तो एई मेसेज टी मु समस्त पाखे पहुंचा पई चाहूची आपण माने विश्वास करिबेनी जदी आमे हम डॉक्टर मानकू खुशी रे रखि पारले जदी आमे तांकू तांको काम रे आमे तांकू डायरेक्टली आमे तो तांकू सहाय्य करि परिबानी इनडायरेक्टली तांकू जदी आमे तांकू पीस दे पारले तांकू गोटे मेंटली आमे तांकू फ्रीडम दे पारले विथ फेथ ताले आज जदी हमर 10 जन लोक भलो होचंती ताले काली तांकर एफर्ट भी डबल हेजबो भलो होतो लोकने भी डबल हेजबे कि आपण मानकू कहबी आपे समस्त मिसी कि डॉक्टर मानकू सपोर्ट करबा नर्स मानकू सपोर्ट करबा तांकू रिस्पेक्ट करबा तांकर ए काम रे तांकू सहाय्य करबा आ शेष रे केवल एती कथा कहबी जे जेतो बेले आमे हमर जेतो आशा पळे जे आमे सब बेले जे आमे भगवान रे छाड़ी देबो तो वर्तमान सिचुएशन सेमती आमे बहुत बे जगह वर्तमान हम हाथ रे किछि डॉक्टर्स माने भी बहुत बे जगह समान को हाथ रे भी किछि रहउनी तो सेही समय रे ए कोविड रो बंचिया पई जे हमर किछि एक्सपर्ट्स के आगुर में कहिथिले
What about the price everyone else has to pay, huh? The world is turning upside down, you lad. You've got to stop.
पास करे पड़िबो तीनटा जिंस
Actually,
को
mute. Somebody can mute it, please.
Sabya,
unmute yourself, please.
unmute.
ओ अच्छा तो मु गोटे जिंस रे ए कथाटी को एंड करिया पई चाहिबी जे आमे इनफैक्ट ए कथाटी हमर किछि एक्सपर्ट्स माने मते कहितिले सेटा होची जे आमे तीनटा जिंस को वर्तमान फोकस करबा टू गेट रिड ऑफ दिस पैंडेमिक दैट इज गॉड फेथ और वैक्सीन गॉड जोटा होची भगवान जो जे होचनी सबुटु पावरफुल जे होचनी गॉड भगवान तो भगवान को केबे भी हमें तांको ऊपर भरोसा छाड़ीबानी जोठी हम देखु जे हमर सबु बाट बंधी जाउची सेठी हमें हमर सबु जिंस को हमें भगवान के पाखे सरेंडर कर दबा आ कोठी ना कोठी देखिबे जोटा भलो होबा कथा सेटा आसीबो आ तापर होची फेथ हमें कहा को करबा जे हमको सर्विस दोची जे ता जीवन को पानी छड़ी की हम जीवन पई तार दिन रात एक कर दोची डॉक्टर होंतु किबा मेडिकल प्रोफेशनल्स होंतु नर्स होंतु तांको ऊपर फेथ आ ता सहित वैक्सीन लास्ट सेमिनार रे लास्ट सेशन रे तो अपन देखिथिबे वैक्सीन ऊपर बहुत कथा में सुनिथिले बहुत डाउट हमर क्लियर हितला तो ए जो गॉड फेथ और वैक्सीन जदी तीनटा कथा को हमें निहाती भाबरे हमर सब कथा को हमें मानिबा सब प्रकार रूल्स जहां भी कोविड रु निजो को बंचिया पे जहां भी रूल्स और रेगुलेशंस अछि ताको हमें गॉड फेथ और वैक्सीन संगे मर्ज कर दबा ताले आउ थर्ड की फोर्थ वे बासिबोनी एटा मोर दृढ़ विश्वास थैंक यू
Thank you, Sabya. I think let me just tell briefly that was a wonderful effort from you for all the frontline workers. And next slide. So I could again request everybody to please mute your phone if you are listening, and please wait for your turn. Questions will be answered based on the collections, and the earlier the person, we will try to answer everybody from the start to finish. So saying so much, thank you again. And then we will start with the question and answer session. I would ask Dr. Atash Naik to take over from here, and I'll be backing him up time to time. Thank you, Atash bhai.
Thank you, Devashish. Namaskar, everybody. As Sabyasachi Koile, God, faith, and these things are very important. So we'll take all your questions. I mean, both question both from Facebook side and Zoom side. And also, upon the question, upon you can raise your hand. I will ask you also. So, and we are here to answer all your questions. Next 45, 30, 45 minutes, we'll answer as many questions as possible. And any question comes to your mind, please go ahead and ask. Okay, before Nihar, you tell me the first question. I see Sanjay Dalai from Dallas, Texas for last 1.5 hours. He is waiting with raised hand. Please go ahead and ask your question.
Yeah, thank you everyone. So I'm Sanjay Dalai. Basically, I'm from Baleswar. So I have been here since last 8 years. So I have bunch of questions, but I'll make it short. Practical experience bhi achi. Recently, I would help a patient ko admission kariware AIMS Bhubaneswar by Dr. C. Pritham. So join sir ko more question. Je ame steroid nele ita hue ki. Ame steroid ta kete % avoid kari pariba. That is one of the question. The second question है इटा कौन COVID negative रे भी हुए ना only COVID positive थिले हुए हमको. Suppose हमें दीटा test नेले हमो positive रे negative है गले. तापर हमको infect करिवो की इटा. Join sir को question more.
Yeah, good questions. Second question रो आरंभ करिवि. देखंतु COVID रो बहुत पूर्वरु हमें black fungus देखुथिले. Before the COVID also, black fungus was there in the diabetic, in a transplant patient, in cancer chemotherapy, we are looking into it. So COVID no hele bhi black fungus hai paribo if you are immunocompromised, if you are taking some immunosuppression drugs, or your diabetes is very poorly controlled. COVID negative विशेष meaning नहीं अपन जानते once positive it remains positive for a long time. Suppose you have recovered well from the COVID, but unfortunately many people start taking steroids, which not only increases the blood glucose, also puts them at risk of the black fungus. Suppose अपना hospital अपना को मासे 1.5 मास पाई taper करी की steroid दला जोटा किसी दरकार नहीं, because few have some respiratory symptoms which can be tackled with inhalers, किंतु अनेके steroids orally खांती ता sugar बढ़ाए और तांको black fungus को expose करे. तो दीटा जिनस मु क्लियर करूची कोविड नथिले भी ब्लैक फंगस हे परिबो, कोविड परे भी ब्लैक फंगस हे परिबो. और सेकंड जिनस डायबिटीज इज द कल्प्रिट. हमें देखिचे मैक्सिमम पेशेंट रे अनकंट्रोल्ड डायबिटीज हे प्रीडिस्पोज करिछि. व्हाट वाज द फर्स्ट क्वेश्चन?
फर्स्ट क्वेश्चन सर थिला कि स्टेरॉइड ता हमें केते % अवॉइड करि परिबा. अपन कहले स्टेरॉइड
Actually, more steroid विषय कहि दउची. This is a necessary evil. If we give steroid, we save life in ICU and critically ill patients. But we must know when to start, how long to give, how much to give, and when to stop. That can be done by a trained doctor only. And amaro dharantu dexamethasone ame easily do for those doctors in the group, and that is 0.1 to 0.2 milligram kg body weight. Second drug is methylprednisolone given 0.5 to 1 milligram kg body weight. Those who are receiving for a short course, it's 5 days. It can be extended up to 10 days and stopped without tapering. Those who need for more than 10 days, it has to be tapered, and properly the blood glucose has to be monitored and controlled with the insulin therapy in the ICU or in the ward. सेटा बहुत important कहीं ना में steroid देई चलिबा और blood sugar control करिबानी ताले problem हबो. All the patient don't require steroid. ओटे कथा मन रखितांतु जे जेते बेले oxygen saturation कमे, somebody desaturating, सेते बेले steroid दरकार हुए, सेते बेले low molecular heparin दरकार हुए, सेते बेले injectable antibiotic antiviral दरकार हुए, सेते बेले awake proning दरकार हुए. ए सब गुडा को सेते बेले आसे. माइल्ड रू मॉडरेट स्टेज को गोटे पेशेंट जाए.
Thank you, Dr. Pandit. Thank you very much.
अतुष भाई क्षमा करियो आप गोटे छोट मोटे क्वेश्चन अछि कार भी पैरेलल क्वेश्चन थाई पर मु पचार दिए ठीक है क्षमा करिवे सर आउ केतरा क्वेश्चन अछि जणे धर डिस्चार्ज हला हॉस्पिटल लु कोन प्रिकॉशन नबो एटा न होबा पई घर को गला घरे जाय के आइसोलेशन रहइबो सो मे बी 1 week or 2 weeks so what precautions he will take he or she will take then other than आई को आउ को बॉडी पार्ट को अटैक करे मु जाना प्रैक्टिकल केस रे आई रे आपन को पानी बहुत हो एमती फुली जीव एमती सो होची आउ को बॉडी पार्ट को अटैक करे गुडा
Jalai, he will take one question, we'll have other people also answer, then you'll come back, okay? Otherwise you won't be able to reach others. This one he can take.
Sure.
Okay, and
Yeah,
after
sure.
I will
Thank
stop.
Quickly I am answering both your questions. Discharge परे आपण दीटा जिंस को ध्यान देबे ब्लैक फंगस न होवा पई प्रथम कथा स्टेरॉइड इंडिस्क्रिमिनेटली निजे निजे खाइबे नाही द्वितीय कथा ब्लड शुगर को परफेक्टली अराउंड 150 mg% कंट्रोल रखिबे आखी छड़ा आखीटा जोटा आपण कहउछन सेटा हला राइनो सेरिब्रल म्यूकोरमाइकोसिस जोटा की आखी नाक और ब्रेन को होई थाए ता छड़ा हमरो खाद्य नली इफेक्ट हुए जोटा की हमें गैस्ट्रोइंटेस्टाइनल कहू स्किन इफेक्ट हुए क्यूटेनियस कहू हमरो रेस्पिरेटरी ट्रैक्ट इफेक्ट हुए जोटा की पल्मोनरी कहू और एटा डिसेमिनेटेड भी हेई पारे बा मल्टीपल सिस्टम भी इफेक्ट हेई पारे.
Thank you. The next question.
Thank you, Sanjay. Thank you, Dr. Panda. And let's go to the next question. I think Nihar, you have a question, but go ahead. You give,
so dita question আছে zoom ro हम start करिबा प्रथम क्वेश्चन होची संदीप महांती पचरचंदी डॉक्टर पंडा how will be a normal guy without diabetes or other comorbidities but after being covid positive and cured is susceptible to black fungus. This question already been answered. We'll go to the next one. Do you have any information of or data or incidence or mucormycosis in patient with one or more risk factor like diabetes and are not on steroid having mucormycosis? It is from
I can just go ahead, just give one data. We just received a paper from Punjab. So they reported 158 cases of mucormycosis, and out of which 32 patients were COVID negative. They didn't have COVID, but they were on very high dose of steroid. So this is one of the paper, but incidence is very low, and they were in high dose steroid because they had some lungs problem, arthritis problem. So they were taking steroid and they got COVID. But overall, the incidence is very low.
So next question, Facebook Abhijit Mahanti Pacharchandi. Can we cure black fungus with medicine?
Yes. The answer is yes. If you report in time, there are 100% chances you'll be cured. The medicine is antifungals. Usually we give amphotericin B and posaconazole as a follow-up therapy for 4 to 6 weeks. I have already told you it's 1 to 1.5 months. And at times, if the infection is very aggressive, you require surgery for debridement to clean up the debris which is deposited in the process of infection.
Excellent, excellent.
Thank you. Now, next question by Nihar Ranjan Das. He has raised his hand. Nihar, can you ask your question, please?
नमस्कार भाइना समस्त नमस्कार मोर गोटे क्विक क्वेश्चन थिला कि I heard there is a air cooler, right? So air cooler sangare kichi relation अछि कि the micro
Yes, the answer is yes. Those who are using air cooler and not cleaning the water daily. आपण जानନ୍ତି cooler रे पानी टा जमा हे कि रहे तळे और सेठी गुडा bacterial, fungal, parasitic growth हुए. Even viral infections are also common from that source. कहना छोटो जगह रे पानी रहिला माने that is a breeding place for many. तो आमे जो ओडिसा रे first patient थिलु, she was using a air cooler at home which was not cleaned and there was water logged inside and that was detected as a source. So जदि air cooler रखिचंती बा कोनसी cooling device रखिचंती जोटी की पानी fill up होउची, please change the water there.
Please mute your phone if you are not asking any question. Thank you.
So next question I'm jiba Zoom chat box through. So होची कि Sarita Patnaik pacharchanti, do only black secretion from nose after COVID is a sign of black fungus?
It's not necessarily every patient who have bleeding per nose or black fungus कहीं ना में pancytopenia भी देखिचु thrombocyte कमी जीवार भी देखिचु जोटी की platelet कमी जाए से माने मध्य bleeding है कि present करथंती तो this is one of the symptom if patient has black discharge or bloody discharge from nose, but the consistent feature is one-sided blockage of the nose, one-sided headache and pain in the eye and nose, and also drooping of the eyelid or closure of the eyelid.
Okay. So next question jone Uttam Kumar Facebook ru कहचंती दुई तीन थर से message करचंती same message.
Okay.
So liposomal, I urgently need liposomal amphotericin B. One of my friend has gone through nose and mouth surgery recently. His condition is serious. Please help Sabya bhai. So question I think it's an appeal to Sabya, so he will take care of it.
Yeah, we'll give it to Sabya. Sabya, are you here?
Yes, I have already seen
But
that.
let me tell here, it's for Sabya, it's very difficult to get now because market is not having that drug. Liposomal amphotericin B is not there in the market. This has taken to the government control. Government has acquired all the drug and it's a centrally distribution. Yeah. So what we have to do, we have to report the case to the government of Odisha, Department of Health and Family Welfare, and the medicines will be released for the person, and Sabyasachi can expedite the whole process.
Next.
Sorry. Can I say something?
We can give posaconazole at this time also, if it is available.
See, what are the alternative available? Because amphotericin B is very difficult available in India. And they are black marketing now. Because I was involved in the Punjab, that 150 cases has come up. I know that. And the second thing is that there is an alternative. I've just texted, this is the government of India, they have promoted what are the alternative antifungal available. I've just sent all everybody to this protocol guideline, ICMR protocol and guidelines.
Yeah, so
Sir, can I come in?
Yeah.
Can I come in?
Yes.
Go ahead.
Yeah. Actually, regarding Odisha, I can tell we don't have liposomal amphotericin B, but we have adequate vials of plain amphotericin B, which can be given alternatively.
Yeah, that we can do it. Yeah.
Sabyasachi, you have any comment you want to say?
No, it's fine.
Yeah, let's go to the next question.
The next question. We have 1 minute. I think Dr. Saptadeepa has a question for. She has raised hand for some time. Please go ahead. Yeah, you are mute. Unmute yourself, please. Okay, go ahead.
Pranam to all the respected panel members. I am Dr. Saptadeepa Sangamitra, a pediatrician. I have two relevant questions related to this mucormycosis, that is black fungus. First is what is the incidence of having this disease when we are using mask again and again? And second question is what is the increment rate of this disease that is associated with using oxygen concentrators instead of oxygen cylinder? As we all know, this fungus is already there everywhere in the environment. So why the cases are increasing now drastically in India? Is this just a coincidence, that is the reflection of low immunity status due to COVID, or is there any other factor that is statistically proven for this positive association?
Yeah, regarding your first question, mask. You see, mask promoting the infection, it's not there. Mask can prevent the infection. So wearing the mask repeatedly is not a risk factor. Not wearing a mask is a risk factor. But source is nature, not the mask. Number two, you ask the incidence going up. During the first wave also, we have reported cases of black fungus. Why it's more in second wave? Because with panic, more people are having stress, they very uncontrolled blood glucose and continuing steroid irrationally, indiscriminately for months together. That incidence has been seen in India, in some part which has reported high black fungus. And another question was regarding second one.
That is the second question. The first question was about the mask. The second question about the oxygen concentrator.
Can I say something?
Yeah, Yeah, oxygen concentrator. Regarding the oxygen concentrator uses a humidifier, and the humidifier should contain sterile, clean water. Or else, if it's a clean oxygen concentrator, there is no increase in the incidence.
Thank you.
Again, one need to be checked, because most of the places in Punjab and Haryana and Maharashtra, they are using the industrial oxygen. That's the reason, probably one of the cause of increase the macromycosis in all over the India. I don't know about how much Odisha is using the industrial oxygen, because the purity of the oxygen has to be paramount to see that things.
Yeah, thank you, Dr. Kyle.
We use medical oxygen, sir. We use medical oxygen, and all oxygen supplied from here are medical oxygen, not industrial.
Right. Let me just pitch in one more here. This impression.
Sir, can I add something? I'm Dr. PK Thakur from here.
Hold on. Let me finish. Dr. Kyle's statement was his personal statement. We don't have any proof to link anything. So what he said, it's not our organization's. Go to the next question.
Yeah. Can I add something? So this is the another part is the third overuse of antibiotics. Another cause, steroid and this immunosuppression and overuse of antibiotics all over the world, using or abusing antibiotics, that has increased all fungal infections.
That's a very important factor, and I have also.
Yes.
Yeah. Let's go to the very good point. Next question, please. Nihar, go ahead for the next question.
Next question is Mahesh Pacharchanti. What is the role of vaccination in case of a patient? Is the person safe if he is vaccinated with both the doses, even if he is diabetic?
Okay, who wants to take? We discussed in detail last time. Who wants to take this question?
Diabetes. Question to diabetes.
Question on diabetes. Let's.
Julie is there. Julie Samantra is there. Julie, you want to take it? Is she on mute?
Devashish bhai, question ta authre kaibe ki?
Go ahead.
कहि दोची जुली नानी क्वेश्चन होची कि गोटे पेशेंट डायबिटिक अछि से वैक्सीन नेला पर इज ही सेफ?
वैक्सीन नेला पर वैक्सीन तो एनीवे नॉट फुल प्रूफ. वैक्सीन हेला परे भी सब प्रिकॉशंस नबा को पड़िबो, इंक्लूडिंग मास्क और सोशल डिस्टेंसिंग.
That's right. Thank you, Julie.
hand raise करचंदी.
Nihar, go ahead. Next question.
Next hand raise करचंदी Prabhu Das. Can unmute and ask question.
Prabhu Das, please go ahead, unmute yourself and ask your question.
My question is why India is a most affected country than other countries, and we can compare with China. So in the second wave, why India is only mostly affected?
Let me tell you this one, sir, that India, I mean, common sense is our population is number one. Second thing is we report cases much more openly than other countries, right? And then each case it varies. So, I mean, we cannot generalize every disease is more in India than in other countries. But comparatively, our government policy, our own individual responsibility also lies on us. But if instruction is given, don't go out, wear mask, people are not wearing masks, right? So how do you justify that? So we are educated mass, we are prone to challenge and ask questions. And if we follow as ideal role model citizenry, then I think we can do it. Okay, thank you. Next.
Okay. Devashish, Nihar, 1 minute. Vijay has raised his hand. Vijay, go ahead. You wanted to say something? Unmute yourself.
Let me unmute. Yeah. Can you hear me?
Yeah. Yes.
Okay. This is for actually Professor Panda. This is actually a continuation from last week. It's a case, 80-year-old patient who is COVID positive, day 7. And his oxygen was 98, 99, but it dropped to 94. I think Professor Panda had recommended that he go to the hospital. So he goes and gets admitted. 2 scenarios. Number one, let's look at 2 different scenarios. One, his oxygen has gone down to 86. What would SCB do in the ward? Second scenario is oxygen stays at 94. What would SCB do? So actually, as a patient advocate, I'd like to know the treatment protocol at the SCB wards, since you're the professor there.
Yeah. So suppose the patient is admitted there, and because the patient is desaturating from a higher
Desaturating,
saturation.
yeah. So the number one, desaturating is already at 86%, 87%.
So 86, I'll definitely put the patient in the ICU, because I will not like to put the patient in the oxygen bed at this saturation. So again, the problem arises for the availability. You know, all the ICU beds are under municipality, and at times for our patients admitted in the SCB desaturated requiring ICU, don't have a ICU availability. But we're trying our level best to make a ICU available and accommodate them. If it's not there, suppose SCB doesn't have a ICU, patient will be shifted to another ICU, maybe in another dedicated COVID hospital for treatment, and will increase the oxygen. I'm sure the oxygen must have been given in the ward or at the transport, but we'll try to increase oxygen from minimum 8 to 10 liters to higher saturation by the high flow nasal cannula or the NIV to maintain at least 92% to 95% oxygen at the ICU. And
Yeah,
if the patient, yeah,
no,
please tell.
Professor Purna, the question is actually, other than oxygen, what would you do?
Yeah, other than oxygen, we are in a regimen, we are giving them the steroid. And as I told you, the choice of steroid is a long-acting steroid. We are giving usually dexamethasone 0.1 to 0.2 milligram kg body weight, and alternatively methylprednisolone 0.5 to 1 milligram kg body weight. And if the patient has not received any antiviral, we are starting with remdesivir. If patient has any other comorbidity like diabetes, hypertension, those controls are met. Patient, depending on the risk factor, are given low molecular heparin or crude heparin. So all the patients of CKD, we are not giving antivirals and we are giving crude heparin. And the patient with a normal renal parameter, we are using the low molecular heparin and remdesivir as an antiviral agent. And we are asking the patient to stay in awake proning, which is helping us to increase the saturation. And with that, we are monitoring the oxygen. After these drugs are added, along with the nutrition and other supportive drugs as per the comorbidity, then the patient is monitored for the oxygen, and it's a controlled oxygen therapy with HFNO, with NIV, or if patient goes crosses 80% FiO2 and approaches 100% FiO2, we prefer the patient to put in an invasive ventilation.
Thank you, Dr. Pandit. We won't go to the.
I think this topic is confined to common people. Our medical fraternity, if they have questions, this is technical. This is going over the head of common people. We are not achieving a goal. Please request medical fraternity. If you have questions, please put questions, write it down, and Dr. Ponda will answer in our group. Let's answer common people's questions so that they can understand in common term, common language. Thank you.
So
Thank
40
you.
plus questions.
Can I just Nihar, can I just supplement? Yeah, I think our experts, Dr. Panda, has rightly emphasized the role of diabetes, steroids, antibiotics. I think we should also emphasize, Dr. Panda, and let us know what you think, that people are taking a lot of over-the-counter iron and zinc. And iron, we know, is a nutrient for the fungus. So I think we should advise them that they should take supplements only under medical supervision and not take it just over the end. We don't know how much they're using it and what is the toxicity of the overdose.
Okay. Yes, sir. You are very right. Now we have papers coming up from zinc overdose with mycosis. So the higher zinc intake and iron overload are also risk factors. But fortunately or unfortunately, we are not getting many cases with similar picture. But the poor control of the blood glucose and abuse of antibiotic and steroid is very common.
Thank you, Dr. Ponda. Nihar, next question, please.
Yeah, next question jiba hochi Mahesh pacharchanti. Next question pacharchanti Sankarsan Patra. If any amount of necrotic material is left behind during surgery, can that be dealt with antifungals?
Okay, we can take that question and the question and I respond that. That's a medical professional medical question. We can take it.
Therapeutic, so we don't want to discuss that in this forum. So maybe we can do that, discuss that individually. Okay. Next one. Okay. Next question.
I have a question.
Yes.
This is for Sabyasachi, and he can comment on this. How is the doctor's life outside hospital, and in relation to the family as well as when they are exposed to public, how they deal with it, and what we are doing to make their life better. In Sabyasachi can answer this question.
Yeah.
Did you understand my question, please?
Okay. Yeah,
Doctor.
Sabyasachi audio ta abda asuni.
Very clear.
So we go to the next question. Go to the next question. Ambai, he will come back. He'll come back. We'll ask.
Next question, Nia.
Next question. What is the role of steroid in mild COVID patient for 5 days, twice a day, from Sandeep Mohanty?
Who wants to take Dr. Siddiq? Adnan Siddiq, yeah, go ahead, please. Go ahead. What do you give me?
It was a great presentation, Dr. Panda. Thank you so much. बहुत बढ़िया presentation कहले. Before I answer, मुझे गोटे छोटो जिनस कहया चाहूँचे. COVID virus, please मने रखन्तु, it's a virus. The most important deadly problem आमर जो होची ओडिशा रे मु देखुची मोर सांग गुड़ा अछंती सेठी, we are seeing is a lot of panic. गोटे very important जिनस आमे को सबु को मन रखिवार अछि is to build our immunity. जोटा को हम ओडिया रे को रोगो प्रतिरोधक शक्ति. That's very very important. एटा सबु को बुझिया पड़ियो. मोर केते अछंती एमती पेशेंट्स जे अछंती जे दौड़ी की जाय कि आज कोविड हे गला, काली जाय स्टेरॉइड्स ने लेनी, काली एंटीबायोटिक ने लेनी, किंबा जिंक ने लेनी, आयरन ने लेनी. मो गुरु एना डॉक्टर अग्रवाल से कहले आयरन, ही very well pointed out. Unnecessary treatment करिबा दरकार नुह. Until and unless आपण मानन को निश्वास नेबारे प्रॉब्लम होची, किंबा आपण ऑक्सीजन लेवल्स ड्रॉप करूची, ताहले आपण कंसीडर करि परिबे गोटे डॉक्टर को पचारि कि स्टेरॉइड्स नेबा पई. आपण को सबुड इंपोर्टेंट जिंस बुझवार अछि. देयर इज ए क्वेश्चन आंसर सेशन रे मु देखिली डॉक्टर्स मानक विषय रे कथा होतले. डॉक्टर पांडा कहले ये कहले ये सबु डॉक्टर्स दे आर ट्रीटिंग 150 पेशेंट्स ईच ऑन अ डेली बेसिस. प्लीज बुझवा चेष्टा करंतु. आपण माने जदी पैनिक करिवे, it is unnecessarily overloading ammanaka sangong, and we are all facing a music. Please do not take any medications, whether it is steroid, whether it is a vitamin or anything. आपण माने exercise करंतु, lung exercise करंतु, जोटा हम spirometer कहूछु, किंबा balloon फुलेवा exercise करंतु, steam inhalation करंतु, गरम पानी रे गरगरा करंतु. But please, for heaven's sake, बिना डॉक्टर को पचारि कि कौन सी औषध नियंतुनी. And steroids are required only if you have breathing issues or your oxygenation drops under the supervision of a doctor. I hope I answered the question.
Yes, you have answered the question very well. We have a lot of questions coming up, so we'll move little faster. Niyar, go ahead, ask question next.
Panelist को request रहिबो टिके 30 second रे आंसर करंतु. 40 plus question अछि हम पाखरे. So next question होची, what progress is been made in kids vaccination? What to be done if they are affected by COVID?
Sanjay Agrawal, please. Sanjay.
Yeah, go ahead, Sanjay. So what we are doing for the kids vaccination, that is the question for you.
Can you repeat the question? I missed it, sorry.
If kids got COVID, like what to do? Is there any progress in the vaccination for children?
Yeah, so most recent update is on the BioNTech Pfizer vaccine is being shown to be okay to give kids 12 years and older the vaccination. But if the child has got COVID-19 disease itself, the infection, I would recommend not to worry for next at least 3 months and then think about vaccination. At least we have data for the mRNA vaccine from Pfizer, but maybe it is going to be good for Moderna as well. So we can give the vaccine, but we need to wait for at least 3 months after the infection. That would be my recommendation.
That's right. Actually, India now the trial has started. I think we discussed last time for vaccine, and we don't have the result yet. We will come to know in September for the kids.
Yes, that is true.
In US,
Thank you,
next question. 12 to 17. Okay, next question, yeah.
Anil Chaudhary Pacharchandi, people treated at home with Flavivу, is there any complication with COVID, Feviflu?
Who wants to, Vijay, you wants to take this question about Flaviflu?
Let's let Professor Panda take it because this is more like a treatment from India, you know.
Okay. Yeah. Regarding favipiravir, it's a relatively safe drug in people who don't have moderate to severe hepatic or renal impairment. Even mild renal impairment is not a contraindication. So those who have good liver function, good kidney function, they can take. Only thing, the doses is little difficult. We give almost 3600 milligram day 1 and 1600 milligram for 5 to 7 days. Many people continue it for 2 weeks. बहुत जन से माने खाई चलती 10 दिन 12 दिन 14 दिन छानिया है कि जोटा कि उचित नुहे एंटीवायरल्स गोटे सप्ताह पर काम करेनी 5 दिन रु 6 दिन रे एंटीवायरल बंद करंतु बटिका टिके बेसी लागि पारे किडनी और लिवर जदी खराब अछि ताको टेस्ट करि नियंतु सेरा जदी सेफ अछि आउ किछि प्रैक्टिकली असुविधा होबनी.
Thank you, Dr. Panda. But one more thing, please remember everybody, the medicine, Flaviflu, Neva Purguru, please consult your doctors. Don't take the medicine just on your own. Okay.
Next. Sir, I am Anil Chaudhary. Just tikke khali gote pachari. Amar neithilu ame me, my wife and son, we had taken Feviflu under the prescription of doctor, the medicine specialist. ताप मने मु कहू जदी हमर हेथिला माने आप पर किछि कॉम्प्लिकेशन कंटिन्यू करि पारे की
नहीं बिल्कुल नहीं तापर किछि नहीं. If you're tolerated the drug well and you recovered from COVID, ebe kichhi tar after effect nahi.
Okay, next question. Babita Agrawal Pacharchandi, what is the side effects of remdesivir and what precaution should he taken?
Dr. Panda, looks like a lot of questions for you.
Remdesivir be would antiviral drug. Side effects actually initially हमें renal और hepatic parameters देखो. In patients borderline it increases the liver enzyme. You know, COVID itself deranges the AST/ALT. The remdesivir therapy also impairs the enzyme levels 3 to 4 times. So usually in patients who are alcoholic, have chronic liver disease and liver disorders along with the CKD, जो मानकर kidney और liver problem था हमें दौना, जो माने नौचंती तंगर liver और kidney function monitor करा हुए. After the course we test for the report. बाकी आउ किसी side effect नहीं. उड़े CBC भी recommended to see the counts. बड़े depression of the bone marrow and counts देखा जाता है तो हमें routinely सीधा करो. Or else it's a safe drug. Action is just to suppress the viral replication.
Right. So apna dekhiba exactly Dr. Panda said that these medicines are given inside the hospital. Inside the hospital, you see apanakar situation kemti thibo. So you see the risk versus advantage versus disadvantage. Remdesivir jetale jia jauchi, I think the patient is pretty sick, or we are trying to prevent that. So seti, this minor kidney function, liver function, we will monitor, but we don't take into account. We have to save the life. So yeah, thanks.
Yeah.
Next.
And then the most important thing, it should not be given at home or domestic setup. Favipiravir can be given, but remdesivir should never be given at residence.
Very good point. That's a very good point, Dr. Panda. Next question.
Next question, Bhagyasri Das Pacharchandi Facebook live chat रे कौन सबु medication avoid करिबा को पड़िबो vaccine नेला परे sir?
Who wants to take it? Sangeeta, are you here? Sangeeta, maybe Sangeeta
Nai. Sangeeta Nai.
Sangeeta Nai. Okay, Vijay, you want to say after the?
Can I say something?
Okay, go ahead. Go ahead, Ajit.
Yeah, it's a two thing. One is that if you're taking the vaccine.
I think the big thing is the one thing.
Vijay, like looks like you are driving. Your voice is cutting out.
3 weeks.
Okay, Vijay, voice is cutting out. Vijay, so let Ajit answer. Go ahead, Ajit.
Right. The thing is that three things in it. One is if the patient, any patient who are taking immunosuppression, either second thing you're taking the corticosteroids, and the third thing is that if the patients are leukemia patients particularly, you should avoid any drug, steroid, immunosuppressant 3 weeks before the vaccines and 3 weeks after the vaccine. Otherwise, your antibody will not form.
Next question here. Next question.
Bijan Dalal Bhubaneswaru pacharchandi, does it have any connection with malaria and typhoid? Se mucormycosis ko indicate karuchandi. And sangare agote question pacharchandi, COVID recover kala pare say is there any chance of spreading to non-COVID people? Se duita question pacharchandi.
Yes or no kar diya tak if anybody answers.
Yes or no? Okay. First, who wants to take the first question? Just yes or no. I don't think there is any relation between malaria and typhoid with COVID. And the second question is, once you are like after 10 to 14 days, the chance of other person, the answer is no. The next question.
Next question, which is, sir, is zinc has any contribution to fungal infection in COVID patients?
I think already we have answered. Dr. Panda has already talked in detail. We don't know yet. And I think a lot of papers are coming up, so we'll wait for the data, more data before we say yes or no. Next.
Okay. Next question. Since everyone is trying to protect themselves and are taking multivitamins, vitamin C, D3 for increasing immunity, ever since its outbreak last year, is it advisable? If so, for how long?
Very good question. Vijay, can you answer? This is your forte. Can you? Is your voice clear? Go ahead and answer.
Yeah, this is actually my question.
Vitamin C and
So
vitamin.
the big thing is to keep the, can you hear me?
Yes.
Yeah, so the big thing is to really boost the immune system. So that comes with food and do the right things. But vitamin D, C, and zinc is important. D, at least we need about 2,000 units daily. But more important is to check your blood levels and make sure your blood level is around 40 or higher. So 40 to 60 would be a really good blood level for vitamin D. Vitamin C, you can do 500 to 1,000 daily. Zinc should not be more than 25 to 40 milligrams a day, never above 40 milligrams daily, because then you don't have toxicity. So these, at least, these are three things that if you take it three months before you get COVID or exposure to COVID, you will do really well. Because I'm following a lot of patients who are elderly, and when their vitamin D is around 40 to 50, they do not get sick. The oxygen levels are actually like in the high 90s or maybe the mid 90s, and they do much better.
Thank you, Vijay. One thing just to remember, please remember, you have to monitor your vitamin D level. You don't want vitamin D toxicity. Okay, next question here.
Next question, Dilip Kumar Raut Pacharchandi, 70% efficacy or 90% efficacy in vaccine. What does this mean? Sputnik is 91%, Covishield is 70%. Please clarify.
Who wants to answer this question? Anybody?
Tadit Mahanti achi na ba ki Tadit Mahanti ab munda ne mein Tadit are there?
Who?
Tadit Mahanti achi na padilani.
Yeah, Tadit.
I think we discussed this last week. It doesn't matter 71% or 90%. Please get the vaccine that is available. Any vaccine is better than no vaccine. So let's emphasize, let's not do vaccine shopping. Please go and get the vaccine that is available. That's the message that is from all of us.
Yeah, plus you can refer to our gato week video YouTube ra achi, please also refer to that. I would recommend.
Covishield 70%, that is after first dose only.
Yeah.
2 doses of Covishield, it's 91% again.
Right.
I think this has been revised recently. See, if it is an Indian variant, it has been come down to the first dose is 35%, and the after second dose is 60%.
Yeah, Ajit is telling
recently
that
revised.
Just came out last week. That's a very good point to remember. But one second thing I just want to mention: COVID vaccine does not cause COVID. So whichever vaccine you get, you just take it. Don't think about it. Okay. Next.
So next question hoji pacharchandi Facebook re Ursani Malik. Sir, vaccine neba 7 din pore side effect ase ki?
It's very rare. Anybody wants to answer? I think it's very, very rare. Usually you get the side effects up to 7 days. Sometimes it can go up to 2 weeks, but it's very rare after 7 days. That's what I have seen in the trial. Dr. Ponda, you agree?
No, there is no side effect after 7 days. There are few actions which are known for the demyelination in spinal cord issues. But here there are no side effects seen, and even the trials are not describing any. So 7 days you remain rest assured, no side effects.
ଗୋଟେ question ଅଛି ଦିଲ୍ଲୀପ କୁମାର ରାଉତ ପଚାରୁଛନ୍ତି Zoom ରେ taking Covishield in the age group of 20 to 30 year of women, is it advisable?
20. Who wants to? Julie? Anybody?
Yeah, Julie. Sanjay is there.
Sanjay, you want to answer?
I think it's me.
I think, see, this is a very controversial question. Is a lot of data has still need to be come up. See that the first one, when the AstraZeneca is used, we have seen all the patients who are getting clot is mainly the age of less than 30. And the most of the people that are using the oral contraceptives. So it is advisable, if it's better to avoid it. I think that will be much better.
What Ajit is saying, I'll just mention the incidence of this clot, which we have talked about last time. After the AstraZeneca is very, very low. Up in 25 million patients, only 86 patients had the clot. I think 64 in the brain and 26 in the abdominal vein. So incidence is very, very low. I think it is safe for everybody. Everybody should take it, unless they have any anaphylactic reaction to any vaccine or something like that. Okay, next question here.
Question which a friend wanted to know when can he take alcohol after recovering from COVID?
Okay, Dr. Sadiq, this is for you. When can you take alcohol after vaccine?
After vaccine, I think there is no data that shows there is any contraindication of drinking alcohol. But if you can abstain from alcohol, your liver will be safe.
No, sir. No, you wanted to know after recovery from COVID, how many days after recovery from the COVID he can take?
So on a serious note, mu ethre koi bhi gote jinsa is COVID re ama pake jo data achi, there has been issues joti ame dekhi che je liver functions slightly elevated hue. So I would be cautious definitely on that. I'm sorry, first part mo bujhi par nathli. I was making a joke of it, but COVID virus causes liver function abnormalities. Alcohol causes derangement of liver disease. So I would be cautious until unless liver normal no hai chimu alcohol no pibini.
Can I say something? That's two things. Yes, you said the right thing that you should avoid the alcohol if the person's liver enzymes is raised. And second thing is that if the patient has any complaint of palpitation or chest pain, they should avoid the alcohol for at least 6 months.
That's right. That's right. Ajit is talking about a long COVID syndrome patient. Next time. Yeah. So you should avoid alcohol if you can, if you have any kind of palpitation, chest pain, shortness of breath, tiredness, or anything. Next question.
You can unmute and answer.
Near how kete question ache? How many questions we have total?
Actually, सब सॉरी थी पुणी एबे 7-8 क्वेश्चन ऐड हिगला.
Okay, then we have time. So, okay. Number 140 and 1 hour 40 minutes. Another 10 minutes we can wrap up.
Yeah.
Ashok Tripathi can unmute and ask the question.
Ashok Tripathi, please go ahead. Ashok Tripathi, you have raised your hand. Please go. Okay, I think maybe he's not there near. Go ahead, next question.
Jajpur News. Mu Sanjay Mahathi, Covaxin nela pare mor uric acid body jaichi.
Very interesting question. As far as I know, there is no relation of Covaxin with gout. Dr. Ponda, you agree? I don't.
It's totally coincidental. He has to change for gout and other renal function. We cannot correlate Covaxin with the hyperuricemia.
Okay. Next question here.
Let me ask here. Thank you so much. So I want to, first of all, I want to salute all these doctors. I mean, from my core of my heart for their presence and time here. It's really, I mean, you are really doing great job and being here, advising us. It's really, I mean, I cannot express in words. Thank you so much from core of my heart. So more sir, gote duta question, small question अछि मु कहूची operation परे आउ regrowth होबो की fungus रो. That is one question. सेटा देला परे आपण जानिबो चाहूची से लिपोसाल आम्फोरे आपण कोन प्रोसेस कोन कारण आमे केबे पेशेंट को हेल्प करियो ट्राई करथलु इट्स वेरी स्लो आई थिंक डेड स्लो रिक्वेशन समान देबे दे विल नॉट एक्सपेडिट इट इवन इफ वी ट्राई टू एक्सपेडिट इट बाय थ्रू आवर दे विल नॉट कोऑपरेट विथ अस सो आई वांट टू हियर फ्रॉम यू इन ओडिशा ओनली आई एम नॉट asking other places only Odisha आपण कोंतु तीटा क्वेश्चन मोर thank you
can I answer
yes
yes
go ahead.
Actually the first one only debridement or surgery is not adequate. You have to treat the patient with antifungal drugs for 4 to 6 weeks. During the treatment the surgery can be done, or after the surgery the treatment can be given, and those who have symptoms and the infection has not completely subsided, a sequential therapy with oral posaconazole is also recommended. So maybe injectable amphotericin followed by oral posaconazole can be given for minimum 4 to 6 weeks and up to 12 weeks depending on the clearance of the infection. So surgery and medicine both mandatory. It's a notifiable disease in Odisha now. So what you have to do, you have to report it to your chief district medical officer if you are in a remote district, or a medical college if it's in the district capital, and then what you have to do, district headquarters or the medical college, you have to give the details of the patient, and patient has to be worked out satisfactorily as a case of black fungus or mucormycosis, and government has supplied the drug with almost all medical colleges and headquarter hospitals for the probable cases. Of course, we don't have adequate vials of liposomal amphotericin B, but amphotericin B is now available as an alternative.
Thank you, sir.
But you have to apply through the authority. District authority is chief district medical officer, and medical college authority is the superintendent.
But sir, आमे करथलो the reality is it's very slow process. आमे करथलो केते percent पई I mean it's very slow process.
Yeah, so once it
and
is
anybody who is around Kotak, you can contact me. I can expedite because I'm in the team of the state government for the black fungus. I can expedite it.
Thank you, sir. Definitely, I'll touch base with you. Thank you, sir. Thank you so much.
Yeah, thanks.
Next question, Nihar.
Number, please. Phone number, please.
Bhagyasri,
Yeah, I have given in the box. Actually, I have given in the chat box.
Address, number or email address ଅଛି top ରେ ଆପଣ ଦେଖି ନିଅନ୍ତୁ please. So Bhagyasri Das ପଚାରୁଛନ୍ତି ଏଇ ସିଚୁଏସନ ରେ ବ୍ଲଡ ପ୍ରେସର ଯଦି 170/100 ରହୁଛି 65+ year person କ ସବୁ ପ୍ରିକସନ ନେବାକୁ ପଡିବ ବ୍ଲଡ ପ୍ରେସର ନର୍ମାଲ କରିବା ପାଇଁ ଡକ୍ଟର ପଣ୍ଡା sir please answer.
Actually, we are seeing people having hypertension, diabetes, obesity following COVID. Post COVID रे उच्च रक्तचाप, मधुमेह ଆଉ ଓଜନ ବା ମେଦ ବୃଦ୍ଧି ମଧ୍ୟ ଦେଖା ଯାଇଛି। ତେଣୁ ଯଦି ଆପଣ ପୋଷ୍ଟ କୋଭିଡ ଡିଟେକ୍ଟ ହଉଛନ୍ତି, ଆପଣ ନିହାତି ଭାବରେ ଆମେ ରୁଟିନଲି ଗୋଟେ ABPM କରୁଛୁ, ambulatory blood pressure measurement କରୁଛୁ, କାହିଁକିନା ଅଫିସ BP is not 100% reliable। କିମ୍ବା ଆପଣ ଯଦି ଗୋଟେ ରିମୋଟ ସିଟିରେ ଅଛନ୍ତି, you can take the office BP or the clinic BP also କରିକି ଆପଣ ବ୍ଲଡ ପ୍ରେସର ଔଷଧ ଖାଇବାକୁ ପଡିବ। ଏଟା କେତେ ଦିନ ଖାଇବାକୁ ପଡିବ ଆଉ କଣ ଖାଇବାକୁ ପଡିବ, that depends on the doctor whom will consult, but ଆମେ ଦେଖୁଛୁ କେସେସ୍ ନୂଆ ଡିଟେକ୍ଟ ହବାର ଆଉ ତାଙ୍କୁ ଟ୍ରିଟମେଣ୍ଟ କରିବା ଦରକାର।
Thank you, Dr.
Tripathi. My questions may be told
next
afterwards. My answer may be told afterwards.
Please tell me 2DG tablet use is benefit. Can it make positive to negative?
Amashita, we have already answered last YouTube, right? They can refer to the last YouTube, right?
Yeah,
next,
that's right. Yeah, next question.
Lisa Satpathy pacharchandi, after how many days of recovery there will be no risk for black fungus if a person has taken steroid?
Okay, for you, Dr. Ponda, again. So
just if suppose you have not you are not taking steroid now, and you are not a diabetic or blood glucose is well controlled, absolutely there is no risk. In the post-COVID time, only because you suffered COVID, there is no risk. If along with that, the immunosuppression is there, there is a risk.
Next question, Abhijit Patnaik Pacharchandi. If Covaxin second dose is not available within 6 weeks, what needs to be done?
Who wants anybody? Maybe you
right.
can.
I say that if anybody has taken the Covaxin, ideally he should or she should take Covaxin. That should be the ideal. But second thing, if you're not available, the patient should know that the chances of reaction is high, because if you changes the Covaxin to Covaxin, but we have still the study is going on, because we have recruited about 2,000 patients here with the different patients. So the result is not out yet, but some of the interim result is there, that chances is slightly higher.
So yeah, please contact with your local doctor there and the local government for clarity.
Yeah, for the second dose, we won't advise any mix and match.
We don't advise. Yeah.
Continuity question अछि उषाराणी मलिक पचारचंदी फर्स्ट डोज नेबर 7 दिन पर फीवर बॉडी पेन होतला कोविड एंटीजन टेस्ट नेगेटिव आसला किंतु हल्का बॉडी पेन एंड हेडेक होची एबे मु आरटीपीसीआर करिबि की
Anybody? Vijay, you want to?
Nanak bhai can take
7 days. There is some.
I guess so. If there is body aches, fever, and runny nose and cough, we have to repeat the PCR test. If it's past 7 days, yes.
Yeah. So next question I got achi Ashwini Kumar Raut kara blood pressure 160 by 100 thile vaccine nahi paribi ki
Yes, I can tell you there is no contraindication. There is no contraindication of taking the vaccine in hypertensive patient. There is no contraindication. He can take, but he needs to take the blood pressure medication. He needs to monitor the blood pressure very closely, because like with a little bit of myalgia, fever and all these things, blood pressure may go up, but he can take the vaccination as long as he is consulting a doctor and taking the medication, keeping the blood pressure in control. Next question.
Post COVID-19 cure, whether it impacts the memory leading to forgetfulness, particularly in old age people.
Yeah, this is a very good question. Dr. Pradhan, you want to take this question? Memory loss or forgetfulness after 6 months of COVID.
First of all, thank you. I thought today was the mucormycosis day. I was thinking, but anyway, this is related. Long-term sequelae of the COVID. We must know that there are a lot of functional deteriorations. So this is one of the things that memory impairment has been reported in the long COVID symptoms. But then we do not know exactly the prevalence of it. Yes, it has been linked to that. It is also linked to a little bit of development of depression and anxiety, and memory impairment is part of that. So at a symptomatic level, if not at a syndromal level. All right? Yes, okay. It is linked.
Thank you, Dr.
I just have to state that all of us should realize that COVID is a multi-system disease. So still there is a lot of research. We don't know what is the long-term impact, but everybody should know that it can affect every organ of the body. So that's my take.
It's a very good answer. Thank you. Go ahead, Niyar.
Next question, Bijoy Jana कहचंती गोटे actually गोटे viral WhatsApp message चलची सबोडे कि 2 वर्ष परे जो माने वैक्सीन नहीं चंदी मरी जिबे तो सेटा से मसे पचारचंती people will die after 2 years who have taken vaccine by US doctors.
Who wants to take this? Devashish, go ahead. You take this.
Yes, thank you. Plus, please don't believe all this. These are rumors. WhatsApp re jauchi viral hochi Nobel laureate, Nobel physician, and all those things. Do not believe all those things. Vaccine, masking, distancing, and sanitizing. Period. Aao kichhi suno nahi, kanna ko band karki just follow. Thank you.
Okay, next, Niyar.
Question was a relative of mine said that he would wait until he gets Covishield as he cannot travel abroad if he takes Covaxin. Is that true?
means he didn't get the Covishield. Now whether he can take Covaxin? What is the question exactly? I couldn't understand.
Question coach, Covaxin nelle he cannot travel abroad if he takes
Well, let me tell you, there are different guidelines by different countries. Like, so we have, this is a question, depends upon where he wants to travel and which country has approved which vaccine. If that vaccine has not been approved by that country, then the person will not be able to travel to that country. So it varies country to country.
Yes, that's true. That's true.
That is true.
Yeah.
You check that country's travel advisory bulletin and you'll get the right answer.
That's
But there's another thing. If you don't have vaccine, you can still travel if you have a negative PCR test within 3 days. So vaccine is, so there's another way to travel depending upon, again, on that country's policies.
That's right.
ठाकुर पचारचंदी Facebook रे कि if a patient in steroid for skin problem, can he take the vaccine? We already addressed this question last session.
Yes.
And next question, Minu Samantrae. Hello, after taking Covaxin first dose, my husband faced severe gout attack. Is there any medicine?
We just answered this question. I think Dr. Panda and me, both of us. So there is no relationship. Okay. Next question.
Vanisri Priyadarshini Pacharchandi, I tested today as COVID positive from an antigen test. Do I need to go for isolation within our home or should I go outside?
If the antigen test is positive, it is more than 90% sensitive, the patient should go in isolation.
Yes.
That's right.
Next, Tilak Mishra Pacharchandi, do we have to take vaccine every year just like flu shot? We answered this question last session. ଆମେ ଏପର୍ଯ୍ୟନ୍ତ ଜାଣିନୁ and ନୂଆ paper ସବୁ ଆସୁଛି ତାପରେ ଆମେ ଜାଣି ପାରିବା କ'ଣ ହଉଛି ଆଗକୁ.
Yes, that's right.
So
next
question. I think it's going to be one.
Yeah, I think we're done. Yeah, we think we're done. Yeah.
All the questions are done. Okay.
Yeah. So everybody, thank you, Atash bhai. Thank you all. And thank you everybody who joined and we had interactive discussions. And sometimes we have to be a little careful how we answer the questions, how we go systematically. So if anybody, I have told anybody to just wait for your turn, I apologize. But we have to run the meeting in a very systemic, so everybody gets a chance to ask questions and interact. Saying that, I thank you all and hoping to see you all next Saturday. Thank you all.
Thank you all.
Thank you. Thank you.
Thank you, everybody. Well done.